Hello and welcome everybody, wherever you may be right around the world. I'm Stephen Sacker, and I'm delighted to say that I'm going to be your host through the course of the next almost 3 hours as we conduct this online event. This is billed Nurses at the Forefront of Change. It will explore the future of nursing, the roles that the nurses should and need to play in the future of our healthcare systems around the world, looking at how we must challenge the status quo and how nurses and their representation needs to change, how nurses need to be the agents of change. Now, this event is hosted by the World Innovation Summit for Health, WISH, and the Nursing Now Challenge. It's also with the support of the BMJ as our academic partner, and we're delighted that all of them could participate and help this event take place. We're going to hear from a range of speakers. We've got fabulous speakers for you, and I'm going to introduce them as we go along. We also want you to be very much engaged and interactive as a part of this whole event. So you can use the chat function to contribute, not just watch, but contribute today. If you want to comment on social media, we want you to use the hashtags Nursing Now Challenge, Nurses 2021, and Agents of Change. So just use those as hashtags, and we will see your messages and your thoughts. And as you'll see through the course of the next couple of hours, we're very much integrating questions from you into our discussions. Now, nurses, as you all watching will probably know much better than me, they make up the biggest, most significant sector of the professional healthcare workforce across the world. I think I'm right in saying that there are getting on for 30 million professional nurses right across the world, something like 59 or 60% of the healthcare workforce. So it is vital that nurses are at the center of discussion of the evolution of healthcare systems in many different ways. And that's, of course, what we're going to be discussing. Even before the COVID pandemic, I think it's fair to say that there was a growing realization that nurses need to be front and center of the discussions about the future of healthcare. But I would say, just as a layman and a user of healthcare systems, that we are all now much more aware than ever before of the centrality of nurses, thanks to COVID-19 and the extraordinary efforts made by nurses right across the world to keep healthcare systems going under the most enormous and sometimes terrifying pressures that we have seen as a result of the continuing COVID pandemic. And I'm sure we'll discuss that more as well as we go along. In the end, this is about voices, making sure that the voices of nurses right around the world are heard. And I hope today is just one small part of that. Now, just to sign, we're going to later on explore the role that nurses can play in the climate change debate. We're going to look at how nurses must adapt and indeed thrive in an increasingly digitized world. So those are two hugely important discussions. And we're going to get early career nurses and what we hope are future nursing leaders to actually grill the authors of papers that are directly relevant to those topics. So there is this element of interactivity that you're going to see through the course of this whole event. We're going to launch 2 new competitions that sound fascinating to me. They're part of the Nursing Now Challenge Global Solutions Initiative, and one is directly related to climate change, the other directly related to this sort of digitized world that we all live in now. So those competitions are going to be launched a little bit later. Our first panel of the day is just about to unfold. We're going to consider in this first panel the important influence that nurses have on promoting good health and access to healthcare in communities right across the social and economic spectrum, inequality, and how healthcare has to take account of social and economic equity. That's going to be the focus of our first discussion. But before we get to our first panel, we're going to hear, and I'm delighted about this, we're going to hear from a very important keynote speaker. She is Elizabeth Ero, who is Chief Nursing Officer of the World Health Organization. Elizabeth, welcome to you. Just by way of introduction, Elizabeth took up her role in 2018, having served her own homeland, the Cook Islands, as a Secretary of Health up until 2017. Of course, when Elizabeth took the job at the WHO, she couldn't possibly have known that the COVID-19 pandemic was going to hit the world and affect so very much all aspects of healthcare, and in particular present a whole raft of new challenges for the nursing profession. Elizabeth has lived through that, has led the WHO's nursing effort through all of that. Elizabeth, it is a great pleasure to see you. I think you're joining us, I'm right in saying, from Geneva. Welcome, and I'm going to give the online floor to you for your opening remarks right now.
Thank you very much, Stephen. Greetings, everyone. I want to say, first of all, thank you to the World Innovation Summit for Health in Qatar, the Nursing Now Challenge, and the BMJ for organizing this important event. Last year, the work of nurses around the world was illuminated on a global stage like never before. Nurses have played a central role during the COVID-19 pandemic, and the combination of the work of the Nursing Now campaign, the WHO designated International Year of the Nurse and the Midwife, and the complex work of our profession in the area of public health, emergency care, and vaccination has been more prominent and visible to all. The nurses' contribution, values, and their role within society has never been more important. Nursing leaders now have a responsibility to pause and reflect on our management of the pandemic, to learn from the events that occurred, the new knowledge and publications, and take the opportunities we now have to influence healthcare strategy, to lead in government and make the necessary shifts in policy and action. Last month, it was a historic moment for nursing and midwifery when countries endorsed a resolution at the 74th World Health Assembly to strengthen both nursing and midwifery, the first for nursing and midwifery for 10 years. The resolution was informed by the Global Strategic Directions for Nursing and Midwifery 2021-2025 document, and is supported by 12 policy priorities that strengthen both nursing and midwifery and ensure further investment in nurses and midwives as leaders at the most senior level in governments. We need to build our capacity at senior levels if we are to follow a course to build sustainable health systems that will ensure we are better prepared in the future. As trusted members of our communities, the nurses are ideally placed to lead the programs of improvement and change that will address the issues that affect the health of our nations and threaten our commitment to achieving universal health coverage and the Sustainable Development Goals. Our successful progress to achieving these ambitious goals now depends on whether we can address these issues within the context of the world that faces poor health as a result of inaccessible health services, lack of clean water, an absence of clean and sustainable energy sources, and insufficient numbers of a competent health workforce. Recent WHO estimates show that in 2019, 2.6 billion people were exposed to high levels of health-damaging pollutants due to the lack of access to clean fuels and technologies for cooking. This causes up to 4 million deaths annually from non-communicable diseases such as heart disease, stroke, cancers, chronic lung diseases, as well as pneumonia. The use of inefficient and polluting cooking in household is a health risk for all, but it is a contributing source of disease in women, children, and infants. At the same time, an estimated 1 billion people globally are still served by healthcare facilities without electricity. Also, 1 in 4 healthcare facilities have no water services. The COVID-19 pandemic has highlighted that access to energy and water sanitation and hygiene is essential for the functionality of critical medical devices and life-saving appliances, and ultimately the delivery of healthcare services. Now, part of the solutions must be to embrace technologies and digital innovations that work in partnership with the traditional skills of our profession. The adoption of innovative learning and working strategies is essential for new health professionals to acquire the skills needed for a 21st century healthcare. The use of telehealth technology is a 21st century approach that is both patient-centered and protects patients, health workers, and communities. It will require reforms in the systems for training and education of nurses. And as leaders, we must support the opportunities that technological advances offer for safer and more patient-centered care. There is a varying presence or absence of nursing leadership in senior national posts, and our voice as advocates for better health for all is often quiet. This must change. Our management during the pandemic has highlighted the crucial position we hold in effective management of the national nursing workforce so that its contribution to population health is realized. This perspective must now be incorporated into health policies and decision-making. From the State of the World's Nursing Report, we know that the presence of a government chief nursing officer and national nursing leadership programs are associated with a stronger regulatory environment, a more educated and better governed workforce, and safer patient care. As nurses, we have been exposed and are affected by the consequences of inadequate planning. And as nursing leaders, we must contribute to the strategies that ensure we are never in this situation again. Our workforce is fragile, but as we move forward, we have learned the importance of having senior nursing leaders at the tables where decisions around the strategy and planning are made. Healthcare services rely on nurses, so nurses must be involved in the decision around how they are delivered. To do this well, we must step outside our own spheres of expertise and engage with those whose stages we share. We need to work alongside economists, lawyers, environmentalists, and politicians. And if we want them to hear what we have to say, we have to understand the world that they work in and the language that they speak. The last year has exposed our global vulnerabilities, but it has also shown that when we are working together and united in common goals, we can build a stronger future. I believe that investments in nursing is an investment in every citizen's safety and security and aligns with our vision, health for all, for those we care for and for us, the carers. I thank you.
Elizabeth, thank you very much indeed. What a wonderful way to start this whole event. Elizabeth there making a clear statement that the voice of nurses around the world needs to be heard at the top table. And we are going to be discussing in detail how that can happen over the course of the next couple of hours. So here we are. We are going to begin by discussing Nurses for Health Equity. Nurses for Health Equity, that's the title of our first panel discussion. I'm delighted to say that we've got a terrific panel of 6 speakers bringing great insight and experience to this discussion. But before we hear from and indeed meet our 6 panelists, let me introduce you to another keynote speaker who I know you're going to want to hear from because he brings fantastic experience to this very subject. He is Professor Sir Michael Marmot, Director of the Institute of Health Equity at the University College in London. Now, Sir Michael has written 2 books whose very titles tell you that he is at the very center of this debate. They've both been very influential in recent years. One was called The Health Gap, The Challenge of an Unequal World, and the second, The Status Syndrome, How Social Standing Affects Our Health and Longevity. So you get a sense there of the decades that Sir Michael has spent studying these very issues. He was also the author of Doctors for Health Equity, which was a precursor report to a new WISH report, Nurses for Health Equity, Guidelines for Tackling the Social Determinants of Health. And this report, this new nursing-based WISH report, is going to be the basis of our panel discussion. But before we get to it, let's hear the opening remarks of Sir Michael himself.
The social determinants of health is an idea whose time has come. When people think about health, generally, they think, quite obviously, about healthcare, and particularly healthcare professionals, nurses, doctors, and others, in general, work in the healthcare system. And when I talk about social determinants of health, a common cry is, okay, we're convinced that the conditions in which people are born, grow, live, work, and age are vital to people's health, and inequities in power, money, and resources that drive inequities in the conditions of daily life. But the cry comes back from doctors, from nurses, but what can we do to answer that question? We helped the doctors when I was president of the World Medical Association. We produced a report on what doctors can do to address social determinants of health. And now I'm absolutely delighted that nurses have produced a report of what can nurses do to address social determinants of health. Nurses have such a vital role to play, highly respected profession, a vital role to play within healthcare systems. But this report is laying out how nurses can play a role not just in healthcare systems, but in improving the health of the populations that we serve. I think it's a landmark report and shows a way forward that all of us involved in health, whether in healthcare, in public health, or in the wider social determinants of health, can move forward to create fairer societies with a fairer distribution of health equity, and the nurses have a key role to play as laid out in this report. I welcome it.
There, the opening remarks from Sir Michael Marmot, and I think that does set up very well our panel discussion. I'm going to introduce you to our 6 panelists right now, and we're then going to hear from one of our panelists just the broad outline of what this report actually says, and then I'm going to chair a debate with all 6, and we want your questions to be sent in as well. But let's just introduce you to our panel, and I'm going to go through all 6 of them as quick as I can. We are delighted to have the Honourable Juliet Cuthbert-Flynn MP. Now, she's State Minister for Health in Jamaica's Ministry of Health. And Juliet, there you are. You've turned your camera on. Thank you so much. It's great to see you. And welcome to you in Jamaica. We've got Dr. Catherine Hanaway, who's the principal investigator for the WISH report, for this WISH report. So, Catherine, you're vital to this conversation. Thank you so much for joining. Professor Charlotte McCardle is Chief Nursing Officer for Northern Ireland. Charlotte, there you are. Welcome to you. Mary Frances McManus is Nursing Officer for Public Health with the Department of Health in Northern Ireland. Mary Frances, welcome to you. Also welcome to Dr. Sana Al-Harashi. Now, she is Research Manager at the World Innovation Summit for Health, WISH, in Doha. Sana, welcome to you. And we have Dr. Billy Rosa. Now, he's Chief Research Fellow in the Department of Psychiatry and Behavioral Sciences at Memorial Sloan Kettering Cancer Center in New York. Billy, we can see you, and it's wonderful to have you as well. In fact, Billy, I'm going to quickly get you to run through sort of the key points as you see them from this WISH report before we get into our discussion. So over to you right now.
Sure. Steve, so great to have you with us. Thank you so, so much. A very exciting discussion already. I want to echo Elizabeth Iro's comments, just our deep gratitude to the BMJ, to Nursing Now Challenge, especially to WISH for hosting this event. And in particular, I'd like to say thank you to Sultana Afdal, who has been an incredible support throughout the conceptualization, the design, and the execution of this report. So I also want to acknowledge all the co-authors of the report, our global steering committee, and really to acknowledge also Elizabeth Iro and Michael Marmot, who provided the 2 forwards for the report that really grounded how readers will engage with the findings of this report. They really link the role of nursing and our recommendations to global health needs and initiatives that are happening around the world. And so I had the good fortune of serving as lead researcher for this report, Nurses for Health Equity Guidelines for Tackling the Social Determinants of health. And I'm just going to give you a quick overview of what we have for you. Next slide, please. So our work really started with a reflection on the Doctors for Health Equity report, which you've heard a little bit about, published in 2016, really under the tenure of Michael Marmot's presidency at the World Medical Association. And they really identified ways the World Medical Association, national level medical associations, and also individual physicians could address and take action on the social determinants across 6 domains of practice. And they really adopted the WHO stance on the social determinants: do something, do more, do better. And we adopted that stance for our report focused on nursing as well. Next slide, please. So these are the 6 domains of practice. And in our report, we provide over 70 recommendations for international organizations, national level nursing associations, and also individual nurses to take action on the social determinants. And it's really important to note that we do not expect any one or any organization to take action on all 70 plus guidelines. Much like the Sustainable Development Goals, nobody expects anyone to act on all 169 targets. We expect readers and organizations and stakeholders to really contextualize these guidelines to your local needs, your local resources, and your local capacity. So I'll just take you through the domains quickly. So education and training is really about understanding the issue and what to do about it. How do we embed social determinants, education, and capacity building throughout nursing, throughout the professional lifespan of nurses to develop social determinants competencies? Monitoring and evaluation is about building the evidence. So really using the best available data at national and international levels and optimizing data capture and the role of nursing within that. Clinical settings pertains to working with individuals and communities, reconsidering approaches to social engagement and building networks throughout neighborhoods and various communities. Healthcare organizations as commissioners, managers, and employers, really to support them in creating cultures of equity and equitable practices for the best psychosocial welfare of their nursing workforce. Partnerships is about working in the health sector and beyond it, really building sustainable, mutually beneficial and respectful partnerships with nurses, with physician partners, with economists, with multidisciplinary stakeholders, as Elizabeth Iro mentioned in her keynote, which is so critical for advancing this work. And then nurses as advocates. Really, we position ourselves in supporting a health in all policies approach, and how can we support nurses in being advocates at decision-making and leadership tables around the world. Next slide, please. And so we use a number of instruments to really guide the report. One of them, in addition to the best available evidence, which we synthesized, is case studies. So we selected, in partnership with our Global Steering Committee, a number of case studies around the world that provide pragmatic and real-world examples of nurses who are doing this work. And they really provide a different shade of evidence from high-resource settings and under-resource settings. So for example, in our Building the Evidence Monitoring and Evaluation domain, number 2, we describe the Center for Health Outcomes and Policy Research led by Dr. Linda Aiken at the University of Pennsylvania, which is just an outstanding exemplar of a program of nursing research that is having global impact in the social determinants and health equity realms. And then we have Partners in Health, a nurse-led palliative care community-based team in the rural region of Liberia, West Africa, who are really integrating social determinants considerations into their delivery of care for the seriously ill, their families and communities. Next slide. Another instrument we used was really to identify, in collaboration with our steering committee, key informants within nursing, really globally recognized leaders within nursing and across disciplines, to get their perspectives on the current and future states of nursing in relation to this work and the various domains of nursing. So for example, these are integrated throughout the report. We have Arwa Owais, professor of nursing in Jordan, who spoke to Domain 2, Building the Evidence. She says a reconceptualization of nursing scope of practice is needed. Leadership skills need to be strengthened and mentoring should be provided early on in nurses' careers. All of this requires strong evidence and research to support the effectiveness and efficiency of new models. Foster a culture of research and curiosity among nurses, and find, develop, and use evidence to improve practice and participate in policy dialogues that will strengthen health and the nursing profession. We see another quote pertaining to education and training from Michelle Upfall at Vin University. I don't have time to read that, but I really do encourage you to download the report and identify all these key informant quotes that really guide the report. Next slide, please. We end the report with a series, this is a particular strength of the report and something I'm very excited about. We end with 7 statements of commitment from some of our major health organizations around the world, including the WHO, Sigma, our International Honor Society, the International Council of Nurses, the Commonwealth Nurses and Midwives Federation, the Nursing Now campaign, and 2 globally active NGOs, JPIGO and Partners in Health. And they really endorse the recommendations that we put forward in the report and commit to disseminating them and aligning with them in their organizational initiatives. So we're very grateful to them. Next slide. And finally, I just want to provide just a brief exemplar of one of our domains and give you just a glimpse of what some of the recommendations sound like. So domain 6, again, is nurses as advocates, and we provide these guidelines for nurse advocacy. So at the global level, we suggest that international organizations really advocate for advocacy training to be embedded and integrated into nurse education, policy, practice, and research, with specific information pertaining to the social determinants. At the national level, nursing associations can advocate for the health and all policies approach throughout their national level agenda. Again, it's all about contextualizing to local needs and resources. And individual nurses can use strong evidence, really important, to educate individuals, communities, partners, and policymakers about why the social determinants matter. And with that, I will stop and give it back over to Stephen and the panel.
Billy, thank you very much. I mean, there's so many different ways that we can take this debate. I hope we can get into several of them right now. And I want to bring Charlotte McCardle in. Charlotte, you're Chief Nursing Officer in Northern Ireland, and I want you reacting to what Billy has said about the nature of this report, where there's a focus on making sure that nurses have the tools and the training to be the best advocates they can be. Do you think there's a lot more work to do in that respect?
Good afternoon, Stephen, and good afternoon, everyone. Delighted to be here today at the launch of the Nurses for Health Equity Report. And I think that in the regards to education and training, there is a lot of work to be done in that space. And I think as a Chief Nursing Officer, I have a personal responsibility in relation to ensuring that the report is both adopted and implemented right across country, as other chief nurses will have as senior professionals, and working with ministers to influence governments to make sure that happens, particularly, as you say, in the space of education and training as underpinning the needs in this report right through, but also including, I think, as Elizabeth Iro mentioned earlier, leadership. And as we've identified in our report, advocacy and the role of a nurse in being an advocate for the people who he or she is working with in their communities. And I think this has been particularly highlighted during the pandemic. The last 18 months has clearly demonstrated that nursing has a key role to play as a global profession, and there is much more that can be achieved when we all work together as a profession, and when our senior leaders come together, for example, CNOs, to make change happen right across the world. The pandemic has highlighted the role that nursing has played in the delivery of healthcare as a basic human right, and recognises, I think, that in our attempts to rebuild our services, nursing is key to making that happen. So I would, in summary, say that I agree, yes, there is much more that needs to be done in order for us to take forward the recommendations of this report.
All right. Well, I'm mindful we actually do have somebody representing government. I don't know if Juliet would want to be called a politician, but certainly as a minister of state in a government, some would see her as a politician. Juliet, you in your role at the Ministry of Health in Jamaica, do you listen carefully? Are you is your mindset one of knowing that the insights and experience of the nursing profession is very important, their advocacy needs to be listened to? And do you believe your government and others around the world have yet tuned in properly to what nurses are saying about the way health systems need to respond to these socio-economic factors?
Definitely. Good morning to you, Chair, and good morning to the rest of the panelists. Definitely, as a policymaker, and as you said, as a politician, we have to listen to what the nurses' needs are, especially in this time of the pandemic. The nurses have had a very rough year, and the doctors also a very rough year for this pandemic. And so we have to listen to what the nurses are saying. They are important to us. Of course, nurses account for a significant portion of the healthcare team globally, and they continue to make outstanding contribution to care of our population, as we have seen in the last year or so, especially the most vulnerable. And even as the world continues to combat this COVID-19 pandemic, let us use this opportunity to thank all the nurses across the globe for their sterling service. I also wish to congratulate all the contributors to this particular report. It is very timely, and the support members of the team who has given a comprehensive analysis of the state of health and the inequalities that need to be remedied. After reviewing the report, noting the 6 guidelines to tackle social determinants of health, we need to ensure that the social determinants of health are included in the education and the training curriculum to ensure that nurses and midwives are knowledgeable and can identify, government social programs that clients can be appropriately referred to for assistance. And secondly, we must move to strengthen nursing and midwifery leadership to ensure quality healthcare delivery that will foster an environment to support research and evidence-based practice in relation to social determinants. Also, as policymakers, we need to establish service level agreements to ensure an acceptable standard of healthcare for all, thus building and improving health information systems to advance technical knowledge for identifying health inequalities at the national level, as well as to encourage all our nurses and midwives to play an active role in policy formation, that is important, and the decision-making strategies that will enhance the delivery of our health services. As it relates to the clinical setting, establishing public-private partnership to address health concerns in vulnerable communities through implementing community health intervention will drastically assist the health system in turn the nation, thus creating a health sector free from bias, prejudice, and act of discrimination for both the staff and the general population. Lastly, our goal for achieving universal health coverage by 2030, we also need to strengthen and collaborate with regional and international partners who can provide financial and other assistance, which will also help us to build resilient health system with a wide variety of service to adequately respond to the demand. So we're doing quite a bit here in Jamaica, and in the context where the Ministry of Health and Wellness has a nursing and midwifery service unit headed by the Chief Nursing Officer, who also has a Deputy Chief Nursing Officer. And Jamaica fully supports the Nursing Now campaign with unit coordinating and Nursing Now Jamaica project, which is implementing a program of action to end violence against women and children, and that is really a problem here in Jamaica. And so the Ministry of Health and Wellness has financed an employment of a project coordinator and project administrator to support the local arm of the Nursing Now campaign. And so those are just some of the things that we are doing here in Jamaica to make sure that we are tackling all the problems that we're faced with in our healthcare system. Thank you, and over to you, Chair.
Yeah, no, that's fascinating. And I know, because you mentioned it, that the WISH report actually does mention the way in which nursing advocacy in Jamaica has had a huge input in policy on trying to combat domestic violence on the island. And that's a very interesting case study where the voice of nurses has definitely been heard. But the truth is, Minister, that if nurses are to speak loud and truthfully about what they see in terms of the social and economic determinants behind some healthcare problems, they are going to ruffle feathers in government? Because they're sometimes going to be saying what you guys in government are doing is not good enough in terms of whether it be anti-poverty programs, whether it be in, allowing inequalities in society to flourish rather than tackle them. Do you think politicians are ready to hear some very tough talk from nurses?
Definitely. I think just looking at the last few years, especially here in Jamaica, what we've had a new crop of politicians that you've seen coming through the system. And so I think we are listening. I think we are ready to listen. And I think it is important for us to also listen to what the nurses are saying and the wider cross-section of Jamaica in order to make policy changes. So I know that we are ready. I am one such politician that is definitely ready. A new face of Jamaica to make those changes happen. Domestic violence and violence against women is a major problem here. And so I think, as women, we've also increased the women leadership as politicians in our parliament. And so I think with that being said, I think we're more likely to listen to what is happening from our nurses.
Great. Well, thank you for that. That's a very positive sentiment. I'm sure we're all happy to hear that. Now, I want to bring everybody else in as quick as I can now and then get to some questions that are coming in online on our different platforms. Catherine Hanaway, I want to come to you now. You're very important to the production of this report. I just wonder how you think that nursing advocacy can best be made more effective in the future. What can nurses around the world and the groups that represent them focus on to make sure that their input to this debate, particularly about the sort of socio-economic conditions that are so important to healthcare and understanding of healthcare problems, how can the advocacy be made most effective?
Well, good afternoon, Stephen, and everyone, particularly our team there on of the report, but to everybody out there that's listening, because I know we've got a lot of nurses, midwives, young nurses in particular who have joined us today. So welcome to everybody. Thanks to the team that helped to put this report together. If you've ever tried to put a report together during a global pandemic, then you'll know what we were up against, but I don't suppose many have. It certainly was a challenge, if ever there was one, but especially to Billy Rossa, who guided me through difficult days, I think, and I him, by keeping ourselves upbeat when things around us were in real despair across the world. So thank you for that. We have got there, and I'm delighted that we actually finally made it to this important day, our launch. We were lucky we had the report out a little bit earlier so that people have had chance to look at it, I hope, and start to look at some of those recommendations, the guidelines that are in it, because that is what is so important about this. We don't want it sitting on people's shelves. So as you say, Stephen, advocacy, influencers, that is what we're looking for now, for nurses to be able to take this work by the horns, really, and take it forward. We need advocacy. We need to strengthen it. We need our senior nurses to be able to have that voice to lead, and we need to be able to upskill them, to give them the confidence, but also the skills to do that. At the same time, we're looking to our next generation, our future leaders, our younger nurses and midwives and those in healthcare, to be part of that healthcare system that understands all of this. So in those 6 different domains, we cover all those areas, from training, from research, from the basic understandings of partnership working and how to be an advocate. We want nurses to be able to rock the boat without falling out of it. We want them to get that seat at the table, but have a voice that goes along with that seat. And I think we're making great strides towards doing that.
Thank you. I asked Juliet about how politicians perceive the voice of the nurses, but I suppose it's also important to consider how the other elements, key elements in the healthcare system perceive the voice of the nurses. That is, the doctors, the management executives who run healthcare systems. Do you think they have yet sort of evolved their mindset, their thinking, to appreciate just how central the voice of nurses must be, as we discussed, you know, really tough stuff like the socioeconomic factors behind so many health problems in the world today?
Well, I started my career in healthcare training as a nurse, a midwife, and a health visitor. And then I very much moved into the public health arena. And I thought I'd kind of left nursing behind me. But I've realized I've far from left nursing behind me. And we want nurses to take nursing with them wherever they go in their careers. I worked for the World Health Organization, designing and delivering health in all policies programs all around the world, actually. And one of the first programs that I ran was in Jamaica, where I met the Minister of Health, Chris Tufton, and we had the whole nursing team on that program. It was the first time it had happened. And for sure, I could see they were getting, if they didn't already have a voice and a seat at that policy-making table. That's what we need to see everywhere. We need the system to understand the importance of having that voice, and we need, as well as nurses. We can't just keep talking as nurses to nurses. It doesn't work. We know that. And we know through the Nursing Now campaign that every board needs nurses on it, but every board of nursing also needs other stakeholders and advocates as well. So I think we're making great progress in that arena.
Thank you. We heard from Charlotte in Northern Ireland. Let's go back to Northern Ireland and get a slightly different perspective from Mary Frances. You work in public health in Northern Ireland, which is a relatively small sort of population and territory, but nonetheless, I'm really interested to know about your experience. How have you, in practical terms, in just real specific terms, maximized the involvement of nurses in some of these key public health questions?
So good afternoon, everybody, and Stephen, thank you for inviting me to speak. So yes, as you say, I do work in public health within Northern Ireland, and we have a population of 1.8 million. And I've had a strong interest in population health and health inequality. So I have been following the work of Sir Michael Marmot, and one of the statements from his report in relation to why treat people when they're ill and send them back to the conditions that have made them ill in the first time. So that statement really resonated with me. So therefore, whenever we were looking at how do we transform the healthcare system within Northern Ireland, it's important that we engage with people within the health service, but also other areas within government. So for example, the Department of Education, the Department of Communities, and identify how can we transform the health service in Northern Ireland to meet the needs and the demands that are facing us within Northern Ireland. And it was very clear to us that you cannot just focus on healthcare. We need to focus on health, and we need to look at the social determinants of health, because where we live, where we're born, we work and we play, those have key those make key contributions in relation to your own health and your health outcome. So within Northern Ireland, we have certainly taken an approach where we are working together in relation to the good of Northern Ireland.
All right. Sana, I want to bring you in as well, because you're research manager at WISH. And in terms of how nurses sort of turn their experience into messaging, which can then be put into the political arena, which can have an important influence on policy making, one of the key elements of this is gathering data, it's monitoring systems, it's evaluating, it's building a data and evidence base. Now, nurses in some ways are very well positioned to do that, because obviously they're at the front lines of healthcare systems around the world, but maybe that's something that they're not necessarily used to doing, to sort of gathering data in a more strategic sense rather than just in the daily healthcare sense. So is that something that needs to be worked upon? Is there training going into that? How important is that?
Thank you, Stephen. Hi, everyone. This is an important issue, monitoring and evaluation, especially using the research. in order to understand the social determinant of health and address the health inequality, we need to understand those social determinants. And for that, we need to collect data and conduct research. We need to move from the medical model that focus on treatment to more in health prevention. And this is required more monitoring and evaluation, which is essential to building the evidence-based and informing our understanding of the impact of social determinant of population. As Billy said in the beginning, we are modeling the doctor for health equity. If we are to do something, do more, do better, we must position nursing science as a cornerstone of population health data science. So leveraging nurse expertise in research, scientific inquiry, monitoring, and evaluation will strengthen the global understanding of the social determinant and provide implication for practice change in various settings. So nurses, they have the access to several data they collected from patients through the system, conducting research. So if they collect all of this data and analyze it, we will have better understanding of the social determinant of health. The WHO, in collaboration with 194 state members, they have data and statistics about health aspect, and part of it about health equity. So regardless of the availability of this data and statistic, but some government, they still have faced the challenges because there were lack of advanced technical knowledge for measuring health inequality, and conducting health inequality monitoring at national level can exist. So monitoring of inequality alone is not enough. There is a need for capacity building in a range of innovative research methodology. Nurses can enhance the monitoring data with translational research evidence, providing greater understanding how we can address the social inequality. So here, there is a need for employing all nurse ongoing monitoring and evaluation process to continue to build evidence. This may include using frontline clinicians to collect and organize data, and optimizing the skill of those with advanced method training to synthesize knowledge and conduct research. So by utilize data at local and international levels will inform service development that meets the need of individual and community, while leverage technology to optimize data capture. So the report outlines several guidelines for this at the international level and at the national level and the individual level, what they can do with regard to research and monitoring. But it's very important to collect data in order to get a better understanding, build evidence that can inform policymakers about addressing the issue of social determinants of health.
Right. Okay. Thank you, Sana. Billy, I want to bring you back in briefly. You gave us a great overview of the report at the beginning, and I do, in a moment, want to get to questions because there's quite a few coming in online. But before that, Billy, I just want to, I'm very aware, as I see you all on the screens, that, you know, we're getting insight and experience from different parts of the United Kingdom, from Jamaica. You're sitting in New York, and we all know that every healthcare system is run in a different way. And of course, fundamentally, there are state-run public systems and there are private systems. And obviously, you in the United States, we associate your system with private healthcare. It's become obviously a deeply political issue, how best to run a healthcare system in the United States. But realistically, Billy, if nurses are to have a bigger voice talking about the connection between healthcare and social determinants, you know, inequality, poverty, lack of opportunity, poor diet for certain, you know, communities, frankly, fundamental inequalities, which we do see in big cities like New York. How much of a danger is there that the nursing voice could become a deeply politicized voice? Do you think that is a danger as we talk about the relationship between, you know, nursing advocacy and building fairer and more healthy societies?
I think that's such a great question. And, you know, at the risk of being bold with the response. Nursing is political. Healthcare is political. During the COVID pandemic, we've heard from nurses around the world who are experiencing high rates of PTSD, burnout, moral injury, because of not having the resources they need to uphold the standards of nursing and healthcare that they really signed up for when they entered the profession. And they need to speak to those inequities. They need to speak to those lack of resources, because the truth is that not having those resources, not being political, not advocating, only continues to endanger the health and well-being of the workforce and create greater distress across the system. And so I think within this report, when we talk about nurses as advocates, they need to be empowered to share the truth of who they are and what they deliver in the health systems. You know, there's a saying in advocacy work, data plus stories makes you memorable. And nurses are working in every arena around the world, in acute care settings, long-term care facilities, communities, social care settings. And so when we think about the stories that they have, the experiences, right, the expertise, they are really primed to bring anecdotal evidence from the communities and persons they serve to kind of merge that with the best empirical evidence and give policymakers what they need to really move things forward. And I think building on Juliet's point earlier about making sure that nurses are educated and trained, this report needs to bridge the gap between simply adopting it and moving toward implementation. So Juliet talked about educating and training nurses, and so we need to recognize that beyond adopting the report, we need to move toward an implementation phase where our policymakers, our physician partners, our economists are fully on board, that they are amplifying the voices of nurses so that the voice that we share, albeit political or not, is not divisive, but is actually just included at decision-making tables and in leadership initiatives.
Yeah. Very well said, if I may say so. Now, we've got questions coming in. I want you all, I know sometimes I can be very wordy, but I don't want you guys to be wordy anymore. I want you to be really concise, because I want to squeeze in as many questions as I can, and we've got roughly 10 minutes left. So let's just do this real quick. First question comes in, and I'm going to put it actually to Juliet. It's from Maha. How important is it for nurses, if they are to advocate effectively, to engage in cross-sector collaborations, to build partnerships outside the healthcare system to address complex social needs? Are there good examples of this? Well, I'm going to have Juliet talk about it very briefly from Jamaica, and then perhaps I'll go to Charlotte as well. Just two of you on this one. So Juliet, then Charlotte, but be real quick if you can.
Okay, so I didn't hear you clearly as to what the question is. Because
essentially, the question is this: how important is it for nurses, if they are to lead and engage in cross-sector collaborations, you know, to build partnerships far beyond the nursing profession, but with others, the politicians, the economists, the sort of bureaucrats in government? How important is it that they find good examples of this practice that they can share and that can convince people that nurses need to be part of a much wider debate?
Okay, so I think I heard most of what you're asking. I think the question was asking how can partnership so that policy making can that the policy can be put forward, and so I think it's very important, as I stated earlier, that nurses have a voice at the table, so that we can make better policies going forward. As I mentioned that it's important in public-private partnership to address the major health concerns, especially in the vulnerable communities, and the proper health interventions in these communities. I think a lot of times our nurses are from these communities, and they know best as what to do and how to possibly manage these problems. And so I think it's important to also include private partnership. Most of our healthcare system in Jamaica is really is not private, it's public healthcare system. And so I think it's very important to have our midwives and our nurses at the table to make sure that the voices are heard and that we have that partnership going to improve our healthcare. And as policymakers,
Juliet, forgive me, I'm going to stop you because we've really only got 3 or 4 minutes left. I want quickly Charlotte to talk about the importance of cross-sector partnerships, and then we'll get a couple more questions in if we can.
Thanks, Stephen. So partnership working is fundamental to how we work as healthcare professionals, and meaningful and sustainable partnerships are really important because nurses live and work in communities and they understand what life is like in that community. They can help and support people in communities to enable them to take control of their own health by working in partnership with them, by co-producing in a respectful way and recognizing the expertise that the person brings about their own health condition, as well as what you bring as a healthcare provider. And a quick example of that in Northern Ireland is the Family Nurse Partnership, where nurses are working with teenage girls who find themselves pregnant, unfortunately, often who come from very difficult backgrounds, violence, broken homes, no parents, who don't know how to parent, who don't know how to cook, who don't know how to educate. And the family nurse is working with them to give them a better start in life. And not only is the young girl getting a better start in life, she in turn gives that child and her child a better start in life. And in terms of a partnership, it's not only a partnership between the nurse and that young girl, it's also a partnership between the nurses and their healthcare system. And it's a partnership between the Department of Health and me as the Chief Nursing Officer, Mary Francis, in her role, Public Health, working with the Department of Education to ensure that the best opportunities are coming for all.
Very good. Thank you very much for that, Charlotte. Catherine, I'm just going to put this one your way. Give me a very quick answer because then we're out of time. I'm a very poor chairman. We're running out of time. Robbie from Birmingham asked this. So specifically, he says, how can governments best help empower nurses to fulfill their role as health advocates and lead change for health equity? So you've been working on this for a long time. Give me your sort of 30-second summary if you can.
Okay, well, I would say pick up the report and read the top lines in all of the domains, because they're all aimed at the sort of global level, then the national level. We talk there to policymakers, to politicians, but we do want to be able to help nurses to understand how to advocate, how to negotiate, and how to talk to those stakeholders at all levels, whether we're talking up or we're talking outwards. We need to be able to do that. We need to be able to do it better. But look to the report. There are lots of guidelines and recommendations in there that we aim right at those different groupings of people.
Thank you, Catherine. She's quite right. As ever with these discussions, there's so much more we could talk about and we should talk about had we more time. But the reality is we don't. So I this particular panel discussion to a close. I thank you all who are watching and listening for your questions. I wish I'd had time for more, but as Catherine said, it is key that we all look at that report, read it, and then act upon it. So do check it out if you possibly can. It's there on the Wish platform, and I do highly recommend that you all try to read it if you can. Now, we're going to be back in a couple of minutes, literally a couple of minutes, with our second session, so don't go anywhere. The second session is going to focus on the extraordinarily important topic of climate change, so come back with us in just a couple of minutes from now for that.
When Nursing Now was launched in 2018, we had no way of knowing just how much the work, dedication, and infinite care of nurses would be tested, needed, and appreciated. COVID-19 has highlighted the vital role that nurses provide, which we all rely on, and it's made all the more extraordinary when we consider the huge sacrifices and personal demands that have been placed on all of you by the pandemic. It has been the hardest of years, and my heartfelt thanks to you and your colleagues around the world for the incredible work you do every day. This short film shows some of the amazing work that Nursing Now has been doing over the last 3 years to develop the confidence, training, and leadership potential of over 30,000 nurses and midwives worldwide. I had the pleasure of interviewing Harriet, who is featured in the film earlier this year. Her passion, vision, and dedication to the community she cares for is both humbling and inspiring.
Nursing Now has united nurses and their allies and created a mighty movement for change. In the 3 years since Nursing Now was launched, the campaign has led to the creation of more than 700 independent groups in 126 countries, and has seen over 31,000 nurses and midwives participating in the Nightingale Challenge.
Nursing Now has opened huge opportunities by involving me in high-level discussions and meetings with global health partners, including WHO.
Over the last 3 years, I have been involved as part of the board in contributing towards the voice of young nurses.
Working with Nursing Now, I learned the importance of working together, networking, sharing, advocacy, the need of empowering early career nurses, and the importance of working with data in hand.
Definitivamente, Nursing Now nos vino a enseñar la importancia de la enfermería a nivel mundial, pero también la importancia de la necesidad de enfermeros y enfermeras en puestos de liderazgo y su participación política en los sistemas sanitarios.
The Nightingale Challenge has been a really brilliant opportunity to galvanise nurses across the globe.
Through the partnership with Badet Trust for Nursing, we are implementing our Nightingale Challenge project in Uganda, which aims at building resilience of nurses and midwives in provision of adolescent-friendly sexually reproductive health services.
It has been an exciting opportunity in being able to learn about leadership and what goes into global health decision-making.
It is very clear that no country will ever be able to achieve its goal for universal quality healthcare for citizens without investing in their nurses and midwives.
Nurses are vital agents of change who can improve health and transform healthcare. It's time to invest in nursing and enable nurses to work to their full potential. Over the next 2 years, the Nursing Now Challenge will work to reach over 100,000 nurses and midwives, inspiring the next generation of nursing and midwifery leaders across the world. Please join us as we work together to ensure access to health for everyone, everywhere.
Welcome back, everyone. If you were particularly speedy, maybe you had time not just to listen to that excellent video, but also to make yourselves a cup of tea or coffee. If you did, congratulations. If you didn't, don't worry. This is going to energize you anyway, this next session of ours. Do remember, as we keep the energy levels high, that you can engage with us through the Wish and the Nursing Now websites, through social media. We recommend that you use the particular hashtags that I mentioned before, Nursing Now Challenge, Nurses 2021, or you could hashtag Agents of Change, and we will see your thoughts, your messages. Now, our second session is going to be somewhat different format from the usual. I think it's going to be fascinating. There's going to be less of me chairing a debate and asking the questions. There's going to be more questioning coming from extremely well-informed young people and nurses who are themselves going to be putting questions to our keynote speakers. So let me explain exactly how it's going to work. We've got a lineup of young nurses ready to quiz an expert in the field of nursing and climate change. Climate change very much front and center of this second session. Now, our expert in this case is Dr. Patricia Butterfield. Now, she's Professor Emeritus at the Elson Floyd College of Medicine, Washington State University. Patricia, there you are, Patricia. Welcome to you. It's really great to see you, and thank you so much for joining us on what I imagine is quite an early morning where you are on the west coast of the United States of America. Patricia is lead author of a new Wish BMJ paper with the title of Nursing and Climate Change, Meeting the Moment. She is, I think I'm right in saying, joining us from Spokane in Washington State in the far northwest of the US. So I can't even figure out what time it is with you right now, but whatever it is, I suggest that you've probably only just seen dawn breaking, and we're glad to see you smiling at this early hour. So, Patricia, the floor is now yours to give us your opening thoughts, to just sort of lay out the main points from the paper that you have produced.
Thank you. It's a beautiful sunrise here in Spokane, Washington, and it's been a pleasure to hear everyone so far. My colleagues on the paper and my co-authors are Dr. Jeannie Leffers and Professor Maribel Vasquez-Diaz. It's been a pleasure to work with them. We'd like to thank BMJ, WISH, and the Cutter Foundation, and most of all, the Nursing Now Challenge for shining a light on this important issue. Climate change threatens human health and existence. And despite overwhelming scientific evidence, the global response to climate change has been somewhat slow and mired in political intransigence and bureaucracy. And in this context, many health professionals have stepped forward to lead. And nurses have been a part of that effort and have done really remarkable work addressing climate action in many places throughout the earth. But we're ready to take the next step. And I want to talk about several assets that I think are fairly unique, and then the recommendations that our paper provides. The assets that I think nursing brings to the table, as mentioned in previous remarks, there's a lot of us. We comprise around 60% of the global healthcare workforce, and we're everywhere. And so if we just imagine the possibility of what it would mean if nurses throughout the world had some facet of climate action in their practice, how we could pivot the response in terms of global climate change. The second thing that we bring to the table that is unique is trust. There are several polls, one in the UK, the Ipsos Veracity poll, one in the US called the Gallup poll. But if you ask citizens who they trust for health information, nursing is frequently at the top of the list among many different types of professions. And I think it's because we are there for people. And then the third asset that we bring is that we work in all communities, in businesses, in schools, in clinics, in hospitals, all over. And we are in places most affected by climate change, that are disproportionately affected by the burdens of health effects due to climate change. So those are assets that I think empower us to take the next step. So nursing through grit, mutual support, we've built a solid body of work in this area. Is it enough? Of course it's not enough. As the Lancet Countdown starkly notes, it will take the work of 7.5 billion people currently alive to ensure that the health of a child born today is not defined by climate change. So let's talk about our recommendations in our BMJ analysis. Number one, accelerate change by leapfrogging nurses into leadership roles. Leadership programs specifically addressing climate action and the development of climate action interventions are needed across the world. I applaud the incredible work of the Nursing Now Challenge Group and what they have done and what they continue to do in terms of their commitment. This work needs to be extended through many different groups and focus specifically on mentor and actionable skills for nurses to lead and have a place at the table in all aspects of climate action. Our second recommendation is to give nurses and students the real skill set that they need to create the future. I could go on and on about this in terms of curricular work. In terms of undergraduate nurses, we're recommending a pivot into risk communication. Risk communication is how we talk with people about how they perceive and respond to risks. Personally, and I'm probably in the minority here, I think there's too much therapeutic communication, oftentimes antiquated in nursing programs. If we pivot into risk communication, which is the vernacular and the vocabulary of how we talk with people about risks, we'll be more effective in talking about climate change. We also believe that nurses need more information about systems, interconnected ecosystems, and sustainable development. Just that perspective, hard-locked, so that they have the skill set that we need. Beyond undergraduate curriculum, as we talk about practicing nurses and their own professional development, they are gems. They are ready to take those steps. There's a great great number and portfolio of resources out there addressing climate change information that needs to be more broadly disseminated so that nurses throughout the globe can find that information and create initiatives to move forward. Our third recommendation is to rekindle activism, advocacy, and relentless truth-telling. There's a new generation of environmental health activists that I find very inspiring. They're restless. They don't want to be talked to. Greta Thunberg is yet but one example of someone that is has kind of a solemn indignation in terms of that we need change and we need change now. I think nursing should not hesitate from using its voice in terms of advocating for scientific-based climate actions, nor should we ever feel that this isn't a part of nursing practice. If taking care of the people on the globe is not nursing, frankly, I don't know what is, but this is central to what we do. Our fourth recommendation is to assure a global viewpoint and eliminate Western biases in nurses' climate action agenda. A lot of the first-gen work in this area has been beautiful work, but it has not brought everyone to the table. And I think the more that we can do, especially in places most affected by climate change, to incorporate that wisdom and that knowledge and make our table bigger and really recalibrate this conversation so that it is much more representative of those we serve and the nursing workforce worldwide. That's so critically important. And then our final recommendation is to make equity, justice, and yes, morality front and center. The convergence of climate action and the equity agenda reminds us that while we're all in the same storm, we are not in the same boat, and that the rich have the opportunity to escape many forms of tragedy, but the poor are stuck in many circumstances. Nursing has a rich legacy of protecting human dignity. The public is comfortable with us talking about right and wrong. We should not be hesitant to talk about the rights of future generations. We should not be hesitant to say that climate change, in essence, represents a theft of the world's assets from future generations, and talk about what's right and wrong. I think the world is ready to hear that, and they're ready to hear that from nurses. We need to strengthen our partnership with our good colleagues in public health, in medicine, in economics, and other professions, and lean in to make our voices heard. So those are our 5 recommendations. We hope you will carry those forward in a way that's true to you, to your home, and to your situations. I want to finish with a statement that's important to me. I first saw it on an email at the bottom of something Peggy Chin had written, and it said, "The future will ask, what did you do? As a profession, as individuals, the future will ask, what did we do? Much needs to be done. It needs to be done very, very quickly by building upon what we know, but more importantly, who we are as nurses. We can alter the path of climate change for the better. We have both the skill set and the mindset to meet the moment, and I look forward to the discussion. Thank you.
Patricia, thank you very much indeed. I found that fascinating. Morality and equity front and center, and that phrase of yours, relentless truth-telling. Well, I'm a journalist of far too many years standing, and that phrase, relentless truth-telling, I love it. I think it's terrific. And I think, you know, nurses, with all they experience day after day after day within healthcare systems around the world, I hope and think that they are committed to relentless truth-telling, and within them is a vast reservoir of experience on so many issues, but including this one about the reality of climate change being a health and well-being issue that is absolutely now going to be crucial for all of us to listen to. So thank you for presenting the sort of outline of your report. You are now going to be grilled, and I'm happy to say not so much grilled by me, but by some young nurses who bring their own insights. And as you said, it's important to get insights from all over the world when it comes to talking climate change, because this is something which affects communities and populations right around the world, sometimes in very different ways. So we need to hear from right around the world. Let me introduce you to the people who are going to ask you questions. We have got, in no particular order, we've got George Chale, who joins us from Mexico City. George, we can see you. Hi to you. Thank you for joining us. We've also got Monashe Nyaika, who is joining us from Zimbabwe. Monashe, we can see you now. Hi, how are you doing? Good to see you. We've got Kurnia Yulian in Indonesia. Kurnia, we can see you. How are you doing? Great to see that smile. And we've also got Amna Zadeh in Qatar. Amna, there you are. Hi.
Hello.
Hello, good to see you too. So we've got 4 young people who are commissioned, Patricia, to ask you questions. So I'm going to sit back to a certain extent and invite our 4 to get going. George, why don't you go first? Tell us briefly about yourself, your thoughts on this topic, and put your question direct to Patricia.
Thank you. Thank you so much. Good morning from Mexico. And I am a young nurse. I'm a young leader. And I'm excited to be here. Thank you so much for the opportunity. And my question for Patricia is, as a young nurse, I have spoken about the issues that I believe in. For example, the 2030 Agenda for Sustainable Development Goals. How would you empower new generations to start talking about the topic that is little explored by nurses, such as climate change? Thank you.
Thank you for that. That's a perfect question. Many years ago, when I was a doctoral student at OHSU, I had a faculty come to me and say, maybe what you're not doing in environmental health is nursing. And that stuck with me. And I want to bring that back to you, because as you begin to move into these areas that are less traditional for nursing, it is you that sets the parameters. And if you go back to the scope of nursing practice and who we are and what we represent, you know that climate change is a part of that, because it's so foundational to the air we breathe, the water we drink, the safety of our people. So I think it is having that, finding that network of supportive colleagues and supportive faculty, and recognizing in your own heart and in your own head that it is not something else, it is central to nursing practice. That's a beautiful question. And I'll flip that back and ask, how do you think you'll venture into that area? What do you think you'll do?
Thank you. I think that it's very important. When I speak about the Sustainable Development Goals in Mexico, we have a different problems because nurses don't meet this topic. Yes. So we need to begin to speak about this problem, to realize an actions with nurses, with young nurses. The problem not is only with young nurses. We need to have the problem with the other generations. And we need to raise our voices and to I don't have what's the word because my English is not perfect. So I think that we need to begin for us, and we need to empower me. I don't have what is the word. So we need to begin to be an agent of change, and to change the vision of nurses and begin to speak about this topic.
Beautiful.
Yeah, I think we all would agree with that, George, and we're extremely pleased that you and so many other young nurses are now absolutely committed to this whole sort of topic and to being active and getting your voices out there and trying to persuade others too to take this so very seriously. So George, thank you. In the spirit of moving around the world at a quick pace, let's go to Kurnia now. Kurnia, you've been listening. Now is your opportunity to introduce yourself, tell us what you do, and then you've got the opportunity to ask a question to Patricia.
Thank you so much for the opportunity. Hello, good afternoon and good evening from Indonesia. My name is Nia. I'm a nurse in School of Nursing Universitas Gadjah Mada, Indonesia. I think that climate change and health is under discussed in my country, and this area is not better understood in nursing field. And I would say this is a novel topic in nursing in my country, and I would like to contribute to integrate this climate change and health education in nurse education, and also for the continuing professional development for the nurses. And as for that, I would like to ask questions about this in terms of nursing education and climate change and health. How to integrate climate change and health into nursing education curriculum and continuing professional development for the nurses while the existing curriculum is already crowded.
Beautiful. That's the quintessential question. I think as a dean of nursing, that was one of the hardest challenges that I faced was what we call the additive curriculum, where you just pack more information in rather than realizing what you're doing is you're educating people to think and create change and that give them examples. I think a lot of times how we've been successful in climate change is to add it, is to attach it to other things. And to go to our, first of all, to have the students go to the faculty and the dean and either president or provost and ask for more information on climate change is very important. And to bring that up in public meetings is important as well. And then to ask, and then to have it attached to community assessment, you know, kind of logical steps in your curriculum, to have it attached to the discussion on mental health needs as we talk about what people experience when they feel trapped, when they're facing, in our region of the United States, wildfire smoke that has just been so terrible, to tie that to the session on mental health, to tie that to the session on asthma physiology. And so oftentimes, I think the students have to lead and then the faculty will follow. But I think if you ask for it and then look for the logical places in the curriculum, there are many places to talk about climate change without packing more information in, but to bring up those very pertinent nuggets to health today. That's a very sophisticated question and I appreciate it. Thank you.
Good. Well, Gary, thank you. I don't know if did you have a follow-up or should I go to somebody else? Did you have a follow-up?
I would like to ask Professor Patricia for explaining about will it better if we do research from the community first to to seek information from the people in the community about their health regarding to the climate change. For example, we are in Indonesia prone to the natural disaster, and we are facing annually natural disaster, and most of them caused by climate change. And is it better to seek information for them about how they feel, how they experience the the health effects of disasters due to climate change, or we start first with the students to gain their voices and to bring or raise this issue up in the faculty level?
I think your early point about collecting some data and research in your own community is critically important. We began a small study here in some of the wildfire smoke where we monitored social media, and we just looked at as the air quality decreased and people were trapped inside and couldn't go outside. And we got themes. We expected a lot of things about respiratory health, but what we heard were things like, I feel stuck. I'm so sad my child can't go outside. My kids are driving me crazy because they've been inside for 5 days in a row. And so it gave us local insights. We could also contribute to the body of nursing science, but it also helped us with entree on how we talk about issues of climate change in our community. My colleagues have continued that work at a much more sophisticated level, looking at a variety of things. But I think beginning with local projects that are tied to your community is a very important way to start, in a way to gain capacity and engagement in your communities. Thank you.
All right, let us again move around the world now. Let's go to Zimbabwe and to Menashe Nyaike. Menashe, you've been listening, and now we want you to tell us a little bit about yourself and what you do. And then, of course, you've got the chance to ask a question to Patricia, so go for it.
Thank you so much. My name is Menashe Nyaike. I am a young nurse from Zimbabwe, and currently in the UK working towards my master's in public health. And really just want to thank you, Professor Patricia, for this report, which I feel is really timely. And really, in terms of Zimbabwe, we see the effects of climate change, particularly in terms of access to nutrition and also in terms of tropical diseases. And so it really is a timely report. And looking at the impact that nurses have in being able to challenge this issue. My question this afternoon is, in low resource settings, such as in Zimbabwe, how do we encourage political will to address issues such as climate change, where climate change may not be top of the agenda or top priority for governments? What would you suggest is key in being able to advocate on solutions?
Wow, that's such an amazing question. I'm not sure I have a great answer to that. So a lot of political will, and I also thought your examples of talking about climate change related to nutritional access, that was really elegant as well. In terms of political will, I struggle with how to push this agenda. As you know, the United States has been in a terribly polarized political context for a while. And so issues that you wouldn't think, like the health of children, like the survival of children, who can be against that? But I think that sometimes it gets politically polarized. I mean, it's just ridiculous. I guess I would say, begin on that common ground that, frankly, nobody can disagree with. The survival of those most vulnerable, the right of everyone to be able to access good nutrition. And then, nursing now, I probably am their sounding box, but having nurses run for office is, that's been a huge thing in several nations. Is that one of the ways to get these changes is you ask nurses to run for local, regional, and national political office, and then they listen. It's quite remarkable. And then I think recommendation number 3 in terms of activism and advocacy. There are safe places to go in terms of moving policies, but there also is the power of trust of nurses and asking and going to those public meetings and making those statements. And once again, if people say that's not nursing, don't let that gremlin bother you, because this is nursing in every way. And so I think you have to push on the policy agenda from a couple of different directions. I'd be interested, I don't want to take us down too far of a rabbit hole in terms of time, but I'm interested in your answer to that question. What would you recommend in terms of how to get access, how to push that in your nation, in Zimbabwe?
I think from my perspective, I'm really energized by seeing, I think, firstly, awareness, the awareness that people have with regards to the effects of climate change, and how this awareness has spurred a lot of action within communities, in that communities are more able to raise issues to their local leaders and also to policymakers, talking about what they feel that policymakers need to do in order to address these issues. And I feel that is really the beginning of it, in being able to galvanize the local community and being able to build it and present it to policymakers.
I agree. It takes courage, and then just having the strength in yourself and having a small network of colleagues worldwide that can be the North Star and tell us all that this is important. If we don't act, we just need to think about what this world's going to look like in 100 years. That's an easy one, and that drives us to think. The future will ask, what will we do?
I think you two are having a very powerful conversation, if I may say so. But Menashe, I just would like to follow up what Patricia was saying. I mean, if we are honest, in some countries, and maybe yours is one of them, sometimes if public servants, and I would include doctors and nurses in this, if they make too much of a political stand, if they adopt positions which the government doesn't agree with, you know, it can have ramifications. It can lead to difficulties. I mean, when Patricia talks about the need for nurses not to back off, to stand up for morality, for equity, to be relentless truth tellers, is that something that really resonates with you, you know, from the country you're from? And do you think sometimes, you know, that is extraordinarily difficult? It takes real courage.
I think it does. It does take quite a bit of courage. One thing that I have found is that through working and through networking with others that are like-minded, you find that it's easier to be able to present issues, and it's also easier to be able to advocate on issues. Coming from a country where sometimes being able to present such issues that are not really favorable to on a political side of things, it is difficult to present such issues, but we also do have quite a number of organizations as well that are there that to support and to really assist in being able to advance that advocacy as well. So I think networking with such organizations and being able to use those channels that they have in being able to present issues is very important.
Menashe, thank you. Let us cross now to Qatar. And Amna, you've been very patient waiting, Amna, but we want to hear a little bit more about you and your question for Patricia.
Yes, thank you. Good evening from Qatar. My name is Amna. I am a young nurse leader. Actually, I want to thank First Wish and Qatar Foundation and Nursing Now for giving us this opportunity to be in this webinar today. It is really amazing, like they connect us as young nurses with all these expert people around the world. Nursing Now Challenge, they done amazing job the last year, and still they are continuing doing that. Actually, when I was requested to choose one of the topic, for sure I went for the climate change. Why I'm interested in climate change? Climate change is one of the biggest global health threats we face today. And all of us, we know that nurses are one of the front lines of communities caring for patients which is impacted by these threats. So it is important for nurses to understand the connection between climate change and health and how the health sector can respond, actually. And also, as she mentioned, the professor, that the nurses are the most trusted profession and largest group of healthcare in the world. So nurses are needed to lead and fight against the climate change. I thank you for giving me this chance to ask one question. The question I would like to ask is, how can the healthcare organizations that we work for better support environmentally responsible nursing practice? What can we as young nursing leaders do day to day as advocates for positive change? This is my question for Professor Patricia.
Thank you. Boy, you picked such a beautiful panel here. How wonderful. One of the things I really didn't get to in my remarks, because they were fairly broad, but the responsibility of nurses to ask their organizations to be part of the solution rather than part of the problem. And so, as we know, healthcare in many countries is an industry that uses a lot of production consumption methods. I believe in the United States every day that somebody's in the hospital between 33 and 35 pounds of medical waste are generated. So that's an important thing for us to remember. There are many people and several nurses that I know and that I hold in very, very high regard that are working across hospital systems to make them more environmentally sustainable, lower carbon emissions, better segregation of medical waste, more environmentally sound disposable, segregation of pharmaceuticals and incineration of materials are two huge areas, as well as anesthetic gases, which have very deleterious greenhouse gas effects. And so if your hospital or your clinic does not have what we call a green team of nurses and other health providers that are looking at every place in the facility to try and make it more environmentally sustainable, that might be an area for you to think about. And it might be that your facilities are already doing a lot in this area. I think student and the type of young leaders that you all are today to really look at what's possible. And that often means it often means going to the basement of the hospital and looking to see how the boxes are disposed, to look at just the transportation practices. I've seen beautiful places where nurses are considered shepherds on each unit, and they make sure that all the IV tubing just isn't dumped into something and incinerated, but is segregated in a way to reduce the waste in terms of doing that. I do think that healthcare without harm has been instrumental in looking at green practices in healthcare. And I can't overemphasize the importance of student. And when I see your faces, all of you, the effect you can have, I do appreciate Mr. Sacker's response that it's always not safe to jump into those conversations in every setting, but easing into that, and especially working in your own healthcare facilities to push and ask, can we look at environmentally preferred purchasing for syringes is a very important step. Beautiful question. Thank you.
Patricia, I completely agree with you that our four young questioners have really gone over some fascinating ground with you, and we're almost out of time, but I just want to add a couple very quick ones that we've had come in from people watching online, but I'll try to be brief, and if you could be brief too, so we can squeeze a couple in. One is from Noah. Noah says, as things stand, are nurses adequately aware of the threats of climate change on health? Are sufficiently aware to actually educate others? How can we better incorporate climate change into nurses' training and career development? A quick thought on that.
That's an important question, just getting foundational knowledge. There are several good resources. The Alliance of Nurses for Healthy Environments is one site where they have just basic slide sets that you can go through to understand. And you're right, you have to know before you can advocate. That information is getting easier to find, to go to. I would go to the Alliance to Nurses for Healthy Environments, as well as several other sites to get basic training in terms of climate change. Great question.
And a quick one from Julia in Toronto. She says, as we've seen with COVID, nurses are, with climate change, again going to be required to react to health crises that are driven by these sort of, huge events that are around us. And they, at the same time, will be affected by these events as ordinary citizens. So Julia is basically saying, do you think that just as COVID may have encouraged, motivated some young people to want to enter the nursing profession, could climate change also be a driver that motivates young people to get into nursing?
I believe one of the publications I looked at, and it might have been from Elizabeth Iro, talked about the lessons learned from COVID. there's got to be something that we've taken from this. And the same thing with climate change. The questioners saying that we are duly affected in the patients that we see, and then when we go home, the challenges we face in terms of childcare, in terms of safety for our own children, in terms of stress in our own family lives. I do think, this is the time to kind of recalibrate those discussions. And I think these are kind of the teachable moments. I hate to think that climate change is going to be the same scenario in terms of COVID, but there are many aspects. As it rolls out in disasters, especially in many of our low-lying nations, there are profound challenges there. So I do think bringing that up in terms of different legislative forums to drive policy change in that moment is very critical. Thank you for that question.
Patricia, really, thanks to you. It's been a fascinating discussion, and I've thoroughly enjoyed sort of sitting back a little bit and having some brilliant questions posed by our young nurses. So thank you to Elizabeth, thank you to our questioners, to Patricia rather, and thank you to our questioners from around the world. Right now, we're just going to change tack and focus a little bit, because I did mention at the beginning that we've got two competitions that we're launching today. The first is a Nursing Now challenge, and it's on the topic of nursing and climate change. And Menashe, who you just heard from as part of the panel of young nurses asking Patricia questions, Menashe's agreed to stay with us. He's going to give us the details of the first competition and how to get involved. And we're then going to hear from Nick Bradshaw from the WISH team, who's going to provide a few more details. But first, Menashe, over to you.
So for those of you who don't know, the Nightingale Challenge Global Solutions Initiative was launched in 2019 in order to provide a platform for nurses and midwives to share and showcase their innovative skills and leadership skills in dealing with solutions and providing solutions in global health. So since the launch of the Nightingale Challenge Global Solutions Initiative, we have had a range of topics, including brain injury recovery, community health, mental health, and nutrition. And now the Nursing Now Challenge Global Solutions Initiative tackles climate change. The Nursing Now Challenge is delighted to be partnering with WISH, with the WISH Foundation, on the next challenge, which asks you as young nurses to develop an innovative approach to addressing climate change in your role as a nurse. We're launching this challenge today, and it will run until the 16th of August, with webinars to inspire and provide context with regards climate change and what it is. So we're really looking forward to being able to have all young nurses across the world being able to join in this challenge. And there is a prize for the challenge, for the best solution that will be provided. And I will hand over to Nick to be able to highlight more about the prize.
Hi, thank you, Menashe. Great to see you again. Someone who isn't a nurse, but thrilled to be part of this nursing event. Hello, I'm Nick from the partnerships team at the World Innovation Summit for Health, WISH. So WISH is a global initiative of Qatar Foundation based in Doha, but reaching out across the world. And it's built on a commitment to build a healthier world through global collaboration. Now, one partnership we are particularly proud of is the one fostered with Nursing Now. Through Nursing Now, we've become advocates for nurses, and through a series of research, training programs, and events like this one, I hope we've tried to play our part in helping nurses unlock their potential. Having worked with Nursing Now since it was formed in 2018, we're delighted to be able to continue that relationship through the Nursing Now Challenge, and to be able to announce that we'll be supporting the two competitions launched today, including the competition mentioned by Menashe there, focusing on nursing and climate change. And we'll be supporting those with $1,000 to each of the winners one for each of the two competitions, and also to offer a place to the winners to speak about their initiative at a Future Wish global gathering. Yes, I suppose a nurse's place is at the bedside of a sick patient at their time of greatest need, but it's also in the community, it's in the boardroom, and it's on the world stage. It's at the forefront of research and innovation, and it's mostly at the heart, the very heart of healthcare. So please, we're delighted to be part of this. Do go over to nursingnow.org, nursingnow.org, and get actively involved in solving pressing health issues by becoming a part of the next Nursing Now Challenge Global Solutions Initiative.
Great stuff. Thank you very much, Nick, and I hope many of you will be encouraged to do just that. Thank you to Menashe as well. We are going to take a very short break. Let's call it a couple of minutes max, time perhaps for you to make another cup of coffee if you need one, but don't go very far, because we'll be back in 2 minutes, and we're going to then be having our final topic of the day, which is a discussion on nursing in an increasingly digitized world. Well, we all know we live in one of those. We live in this digitized world. That's why we're having online discussions like this. So don't go away. We'll be back in a couple of minutes from now.
من أكثر التحديات الاجتماعية والتنموية الحاحة في العالم كله هي قضايا التعليم والصحة. فكلما نجحنا في تحقيق تقدم ما على مستوى الرعاية الصحية نكون بذلك قد أوفقنا في الدفاع عن المستقبل وأجياله.
We are privileged to be witness to health diplomacy in action, building stronger bonds between nations through our common health.
I'm here to appeal to each and every one of you to join the coalition to deliver those 1 million lives saved.
We are stronger when we work together, when we are driven by our common ambition to improve health and healthcare at home and across the world.
I'm grateful for the chance to play my part in opening up the conversation about anxiety and depression.
In this hall, I see many talented medical professionals with an almost unparalleled capacity for technological innovation.
A healthier world is within our grasp, but we can succeed only if we are determined in our efforts.
WISH's commitment to improving the lives of people and communities everywhere will help to drive the spread of innovation and change in healthcare we need to face the challenges of current and future generations.
نأمل أن يكون هذا المؤتمر حافزاً للابتكار وبيئة عمل للمبتكرين في المجال الصحي.
Welcome to WISH 2020.
أحيي العاملين في القطاع الصحي في قطر وفي العالم أجمع وثمن جهودهم الجبارة في مكافحة الفيروس وحماية الأرواح والإسهام في بناء عالم ينعم بصحة أفضل.
I am very, very thrilled to join you for this really, really crucial topic.
We're uniting the world's best and brightest across many fields for a common cause.
So Bleeper is a flagship communication platform.
Our vision is to eradicate PCOS underdiagnosis.
Let us not forget that it is only on the firm foundations of sound and resilient public health that economic recovery can be built.
However, the Nuba are a people deeply traumatized due to centuries of oppression and marginalization at the hands of the Khartoum elite.
Combining cure and care is not a wet word. It's a small revolution in public health policies.
Early detection and early intervention is associated with improved outcomes.
The terrible effects of the virus have reinforced the need for the worldwide community to work together to combat health crises. This is the very essence of WISH.
Together.
Right across the world, we have been witness to great courage, cooperation, and compassion. If we keep working together, we will heal. One word, our health.
Welcome back, everybody, to our last session for the day. As you saw, it's entitled Nurses in a Digital World, and we are going to be exploring how the nursing profession is being affected and can best leverage and utilize this fast-changing digital world that we live in. I'm delighted to say that we're using the same format we used in the last session, because I, for one, thought it was fantastic. It was a really interesting way of tapping into the expertise of an established thinker, but using the creativity and the thoughts of young nurses to do the questioning. I can sit back and our young nurses can do the work. I thought it was fascinating to hear from Patricia on climate change and nursing, and now we're going to do the same thing with this digital world challenge that we all face. Our expert on this topic is Dr. Richard Booth. Now, he's Associate Professor at the Arthur Labatt Family School of Nursing at the Western University in Canada. Richard is the lead author of a new WISH BMJ paper, which is entitled How the Nursing Profession Should Adapt for a Digital Future. And there is Richard. Richard, it's great to see you. I believe you're joining us from London, Ontario today. So I appreciate it's still fairly early with you, but we're very thankful you could join us. And I'd like you, if you would, to take over from me and take us through the main points of your paper. And then, of course, you're going to get grilled by some young nurses. So bear that in mind. But first, let's hear a little bit more from you about your report. Off you go.
Great. Well, thank you very much. It's a pleasure to meet you, and I'd like to thank the WISH Foundation and Nursing Now Challenge for the invitation to discuss our paper that was published in BMJ. So our co-authors here that we have, Jillian Strudwick, Susan McBride, Siobhan O'Connor, and Anna Lopez, we pulled this work together in a very interesting time in nursing's timeline. So I want to start with that. If I can have the next slide, I'll move on from that. This culmination of this work and what I'm going to dig into differs a bit from what Patricia and Dr. Powderfield mentioned before, but has so many similarities I thought was striking. So what I'm going to do is, instead of giving the key recommendations per se, I'm going to speak around the recommendations in terms of the thematic elements that we think are really important for the nursing profession to start to conceptualize and think more deeply about moving into the future, especially related to our digital future. So can I have the next slide, please? Now, this paper, and I think this context will be somewhat important, was written roughly between the first and second wave of the pandemic, around Christmas, December of 2020. And that really did influence, in many respects, the complexion of the topics that we saw here, because we are living in extraordinary times. And I think in some respects, the fact that we're having this type of webinar, fully digital and virtual, really speaks volumes of where the world has come in terms of digital health and moving into the future. So I'll walk through some of the key messages now of our paper, and then I look forward to the discussion with the young leaders. So what we've decided to do here is to outline the major headings of our work and speak to the key messages per se. So nursing has a significant lineage with digital health and health technology. Many decades worth of literature exists looking at the innovations and successes that we've had. We have a really nice established informatics background, health technology, evaluation, practice. It is very substantive, and I always want to give kudos to that kind of body of knowledge, because that's what really we're working from in 2021. But there are also challenges from that. We have lots of things that we've seen that have been benefits. We have digital health, we have telehealth, we have models of care that are virtual now, but we still have technology that is honestly pretty clunky for being in 2021. And some of the feedback that we've received on Twitter and through the BMJ portal has been that, the user experience on technology is still not up where it should be. And that's completely accurate of today. A lot of our systems have not been designed for end users like clinicians and nurses, and they still retain very, very rough edges and disrupt workflow and create unintended consequences. So on page 2 of the work, we really go through a lot of the selected technologies in a very much more targeted sense in terms of looking at both the technical side and the social side, because as socio-technical researchers, we always want to balance the two elements together. Technology is just not technology. It's how it interacts with people and how people interact with technology. So the benefits and challenges that are listed there really demonstrate a number of decades of innovation, successes, but also limitations and challenges that we need to overcome. And there's a lot of challenges that we have yet to overcome that are going to become even more troublesome as we move into the future. So moving along with that, where do we see that going? How do we start to address some of these challenges that we have and leverage the benefits that we already have collected? Leadership is where we need to go with this. And I think leadership, drawing a little bit from Patricia's presentation last, is needed in this domain. Leadership in health technology and digital health has been well developed in nursing, but we need more. We need new types. The chief nursing informatics officer is a role that's starting to become more popularized in certain countries. We need individuals who are in nursing sense at all different types of leadership to really understand that digital health is no longer that technology, that thing, that electronic record. It is everywhere. And we're currently living in a digital world, which I'll get to in a more grand sense as we move forward with this. Education, in our estimation, is how we're going to probably get there the quickest. And this is not going to be an overnight sort of thing. This is going to be a long process, but we really need to think about our young leaders and our students and our practicing leaders, how we can start to embed different types of education to help develop insights and recommendations and future strategies so we can become a digital profession per se. Now, I get when I say that, there's usually the front back going, ooh, Richard, these are certain things that may not work with the lens of nursing and our theory of nursing, how we want to deal with and manage and interact with patients and clients moving in the future. But we got to keep in mind that, like Patricia said, that she was told that climate change wasn't a nursing topic. I was told the exact same thing 21 years ago when I started my nursing degree in the undergrad degree. I was told by a nursing prof on virtually the first day of class that technology is not a nursing topic. Well, it very much is. So we need to think about new areas of education in terms of, co-design, data science, artificial intelligence, user experience. Like, these are domains of nursing that have little bits and pieces that have been started, but we need to make these more of our own to move them into the future, because they are essentially where the future is going to be going and how we will be interacting with cross sections, not all, but definitely cross sections of our consumers and clients. And that brings me to point number 3, the emergent technology side. This is the stuff that sort of keeps me up at night, to be perfectly honest, like the artificial intelligence, the automation. Equity is a massive component of the lens of nursing, and was mentioned in terms of climate change, and I'm going to bring it forward here again. If we're still concerned that our user experience with an electronic medical record is poor, we haven't seen anything yet until we have automated inequities into new types of artificial intelligence that are going to be creating decisions for us in the coming decades. This is the stuff that I really, really take home and think that my 7-year-old who's currently learning online because our schools are still shut here in Ontario, Canada, this is the kind of world that she's going to have to manage. We are already subjected to so many different types of artificial intelligence and automation in our day-to-day lives, whether it's you buy something online, whether it's your car GPS telling you to go somewhere, whether it's all the other things in the background that are shaping our decisions for us. These are things that we need to look at from a health equity perspective, because we will start to automate various types of inequities into these systems that will have very, very latent and unintended consequences in the future. And there's already a whole body of literature looking at the automation of unintended and inequalities in these types of systems. So that's something I really want to stress at point 3. Moving along to our point 4, we need to think about what the nurse-client relationship looks like moving into the future. And it is going to be digital in some places. COVID has definitely demonstrated that things that we thought couldn't happen virtually are now happening virtually. And in some respects, in some parts of the world, I can't speak for a sweeping generalization, digital first has been the way things have gone. And we're not going back. Historically, patients came to us. It's not going to be the same way moving into the future. And we need to re-envision what our relationships and our dynamics and our power structures with patients are going to be, because patients can do a lot of things themselves now. Now, there's always going to be the types of clients and patients where we need them in acute care organizations, hospitals, and things like that. But there's whole other types of healthcare, which have been mentioned. I believe Nick went through that just briefly, that physicality isn't going to be the essential driver of it anymore. We need to reconceptualize what our relationships are going to be. Moving to the end here, evolving digital practice. I think this is a cultural shift that nursing needs to really think about. We've had numerous decades of lineage looking at nurse relation, technology, client. We need to start thinking about what our practice looks like in a world where borders and walls and digital ones and zeros essentially becomes fluid, where we have ecosystems of healthcare that are digitized. Because really, until we start to introspect on ourselves and our cultural and our theoretical understandings of what nursing is, we're not going to be able to move forward. And I get a lot of flack when I start kind of going down those pathways, because it challenges what we think nursing is, because we're challenging what nursing was. We need to think about where nursing will be in 10 to 20 years. So really that kind of leads us to our final comment of remaining ahead of the curve. And honestly, I don't think we can remain ahead of the curve, but we can try to keep up to it as best we can, because the curve is already ahead of us. There's a lot of things coming down the pathway. And as I was told roughly 21 years ago, that technology is not a nursing topic, we can see in 2021, it very much is. And we need leadership. We need young leaders, like the individuals who are going to be asking questions next, to take these messages forward and to push them into the future and to create the models of healthcare and the patient interactions and the technologies that envelop equity as opposed to create divisions. Because if we don't, we're going to miss the ship. And this is definitely a ship that we don't want to miss moving into the future. Thank you.
Richard, thank you very much indeed. This is a digital profession, you say, and technology has to be a huge part of a discussion of what nursing is to become. These are fascinating thoughts and very big thoughts for the future of nursing. And I think it's great that what we now have is a group of young nurse leaders, and I dare say many of them very much more digitally savvy than people of my generation, who are going to be probably shaping nursing, looking ahead to sort of 2030, 2050 and beyond. So let's introduce them right now, and then they can put their questions to you. We have Jessica Goodman Casanova, who is joining us from Spain. Hello, Jessica. I hope you can hear us loud and clear. We have Sana Gul, who is joining us from Pakistan. Sana, you with us?
Yeah.
Great. Good to see you. Stephen Kofi Osai is in Ghana. Stephen, hi, can you hear and see us?
Yeah, I can hear you guys. Hello.
Great. Well, we can hear you, so that's terrific. Ariani Pertiwi is joining us from Indonesia. Ariani, hi.
Hi, how are you?
Yeah, we're all well. Speaking for myself, I'm great. And, the others are looking pretty well too. And we are also joined by Alice Thompson in Scotland. Alice, there you are. Great to see you too. So, look, we've got a terrific team of young people here, Richard, and I'm going to hand over to them to ask you some questions. Jessica, you kick us off. Tell us a little bit about yourself and what you're currently doing, and then whatever thought or question you want to put to Richard, just go for it.
Hello, thank you very much for having me. Thank you for the Nursing Now campaign, and congratulations to Richard and the rest of the office for their paper on BMJ. I thought it was very interesting. I am working at the Institution of Research in Malaga as a mental health nurse specialist and researcher. And I've been working on digital technologies for the past 3 years in different Horizon 2020 projects with different technologies such as smartphones, TV-based applications. And so I've been working on the co-design of these type of services with the end users and their caregivers, as well as different associations of patients. So the question I wanted to ask was, which assets do you think that nurses have on research to work on the co-design from the first moment of the technological projects with the technological team and the clinical team, so that the patients and end users can have tailored solutions in this digital world? Thank you.
That's great. Thank you so much for the question, Jessica. It's a wonderful question, and co-design is definitely an area that has become a known domain that nurses have become really quite passionate about. And there's a number of Canadian authors that I can think of who are in this. Co-design, I believe, is definitely a way to move towards the future in terms of a lot of health technology, because I think what it does, it starts to invert this very paternalistic approach to making technology, which has essentially still exists, but because of our tenets as nurses, we understand how clients, how they interact, what they want. We are able to work with them in a collaborative fashion. And I think also our understanding of the healthcare structure and its workflows and its processes also give us insight into how technology should operate. So a lot of the current complaints that we have of our current generation technology is it disrupts workflow, creates unintended consequences. It's just generally clunky for the sake of where we should be. When we start taking co-design, we actually work in a much more participatory fashion, like as you know, with all sorts of different designers, people, to really come up with a collaborative product that is going to benefit not just insular parties, but parties in general. And I think that kind of collaborative approach is definitely something that we tried to speak about in the work, but I even took a look at the Wish Foundation. They have a whole report on co-design as of 2018. So this is something that I'm so excited to hear that nurses actually know the word, young leaders know the word, and are using this as a methodology and as a heuristic to help build technology that's going to serve clients and support the nursing role moving into the future. So I hope that helps a little bit with your direction, and it's I fully support it, and I'm so excited to hear people doing this.
Thank you very much.
Great. Well, thank you for the question, Jessica. Let's go to Pakistan. Let's join Sana. Tell us about yourself, Sana. Just tell us what you do right now, and then you've got the floor to give your question to Richard. Yeah, Sana, we're going to have one more go to connect with you. We're just struggling to hear you right now. I don't know if you can hear me. We can see you, but you're freezing right now. It may be a problem with the internet connection, but just if you can hear me, have one more go at telling us about yourself and asking your question. Well, I'll tell you what, Sana, if you can hear me, we're having trouble hearing you, so we'll try to come back to you in just a moment, but we'll go now to Ghana, to Stephen Kofi Osai. Stephen, I'm hoping you are hearing us okay right now, and if you are, you tell us about yourself, and now you take your turn to ask Richard your question.
All right, thank you very much. I am the final year nursing student at University of Ghana, and I'm currently working with people, I'll say friends, on developing a telehealth platform to support patients who have suffered brain injury in Ghana, and now they're undergoing neuro rehab. For coming to my question, I would like to ask, as a student nurse in, I would say, a middle income country, it is quite challenging for populations in these parts of the world to have access to technology, and it's even more difficult for health systems and nurses to have access to technology that would make them meet up with the curve or be ahead of the curve. So I wanted to ask, I really loved your recommendations, but then looking at them, they didn't quite feel personalized to someone living here. For nurses in lower middle income countries, what do you recommend? How do they catch up with those in developed countries?
There we go. That's a great question. Thank you so much, Stephen. And we tried our hardest in the paper to ensure that we spoke about broader context beyond Western countries, but the bias with the majority of the authorship team being in kind of resource richer context, we had Anna, who was from Costa Rica, who very much brought the lens back that everything you're talking about, Richard, we don't have, and so we're cognizant of that. And this is actually an equity issue moving into the future that I think is omnipresent kind of everywhere, both in terms of how we develop technology, its use with clinicians and clients, and then even just access to basic things. But what I would suggest in some respects, is there's things that we can do that can help move the world forward collectively. And I think it's our universal voice that we have. There's lots of different lower kind of what's the word I'm looking for? Other approaches that we can leverage that don't have to be the creme de la creme, the apex level EMR, the types of, we have things like this, which are becoming way more consumer and context relevant in certain areas that are lower in resource intensity that can be leveraged. So I think sometimes we get really technocentric and innovation biased when we start talking about technology, where we must have the latest shiny thing. And if you have ever spoken to me for any length of time, you know that I'm generally pretty critical about technology. As a technology researcher up front, I'm usually critical to start off with, because sometimes the pen and paper is actually the way to go about things. But in light of the pen and paper, we still need to think about the larger societal and larger global move that is moving forward. So I would suggest, think about the resources you have currently in your context and your surrounding, and how you want to advocate from a political, from a resource, from a policy perspective, to start building in logical chunks. And once you start doing those things, you start to realize you have lots of things potentially available that are very leverageable, but don't seem like they could work. But they'll work totally fine within potentially the context you're in. And it's that stepwise process of thinking, what kind of resources, what kind of power do I have right now, and placing those things into place. So some of the recommendations in the paper, yes, are very big and very grand, and probably come with a little bit of a technology lens that some areas of the world may not have access to. But the issues that we're facing right now, you might be in 5 years. So the learnings, I think, are something that might would be really important to pull forward and move forward in terms of your context that you're in. I hope that helps a little bit. It's a wicked issue, which I think really needs to be looked at from a much larger equity issue. But I really have hope for the nursing profession moving in the future.
Stefan, does that resonate with you? Richard acknowledges it's complicated, but does his approach make sense to you?
Yeah, it quite resonates with me, but then I also believe there should be a different way that we look at this in different contexts and in different countries when it comes to improving digital health. If some country could just develop apps and use it as a virtual ward for patients, we would probably have to consider already developed apps and that we use low resources like WhatsApp to get in touch with patients. So yes, Richard, thank you for answering my question. And yeah, it's best to look at it in a very local context.
Good. All right, Stefan, thank you very much indeed. I see Sana's back with us on the screen, which is good news. Sana, if you're hearing me, we know you had some difficulties with your connection a short while ago. If you can hear me now, have a go at telling us about yourself and asking your question to Richard right now. Huh. Well, she's not giving up. She keeps coming back and trying to join our discussion, but such is life. Perhaps fitting that our glitches are all coming when we're discussing the digital world and nursing, but inevitably, now that we're on the topic, we're having some digital problems. Sana, I'm going to give you one more go just to see if you're getting through on your connection. Can you hear me? Well, Sana, I suspect you can hear me because you're smiling, but we can't. At least I can't hear you. So I'm afraid for now we're going to have to get somebody else to ask a question. I'm really sorry, but we're having some technical problems connecting with you in Pakistan. Let's go to Indonesia, to Ariani. Ariani, you've been patient, you've been listening. Now's your chance to tell us about yourself and ask a question to Richard.
Okay, thank you, Stephen. Hi, I'm Ariani. I'm a nurse and faculty member at Universitas Gadjah Mada here in Indonesia. First, I would like to thank Wish and Nursing Now for the opportunity. It's amazing that they bring us into the high-level discussion with experts. I would like to congratulate the authors of this report. Thank you for writing this. I really appreciate it. I've been involved locally in building digital health, including developing mobile health initiatives to increase patients with MDR-TB compliance to treatment, and evaluation research on the national telemedicine initiatives. The points that mentioned in the reports are all, for me, relevant and important. I can't agree more on all points how you see nurses facing these digital challenges from the health system to the bedside. And I see what is happening here in my setting. Like you mentioned, that this profession commonly use practice system that lack of usability. That is one of my research interests. I found many of these issues in clinical settings. About the nurse-patient relationship, I agree on what you wrote. I don't see that the advance of technology will impair patient-nurse relationship. Well, it depends on how you deal with that, of course, since this is what people now need on their situation, in our situation right now. They are busy and we are now in a pandemic. We need to keep in distance. So this technology, for me, could bring better engagement with the population. So my question is, how do you think nurses in their early career can contribute and be involved in the leadership and investment that support nurses to lead digital initiatives? Since, the early career nurses are usually the ones who engage with the digital solution. And on the other hand, also you mentioned in the report that this profession is still cementing its relationship and leadership in health systems. So I would like to hear from you. Thank you.
Thank you so much. That's a great question. We could probably have a couple-day conference, honestly, to unpack the different dimensions of that. But I think in some respects, and you can speak to any of my undergraduate populations, my graduate school populations that I speak to, I always look towards the coming generations of the people who are going to be making the change. And it's everyone on this call to my right on my screen here, because you already understand the dynamics in the world that you exist within, and you are going to be that change agent within the profession who can both inspect the legacy of nursing and all the benefits and the challenges we've experienced, but also challenge it in a way that I think only new people coming to the profession can do, where you start to see the ecosystems, the digital ecosystems that you currently live within. And I can't speak specifically to the context and the countries you're in, but I think we can all kind of resonate the fact that we have a WhatsApp going on in the background here. We have this call that's live across numerous different continents in real time via stream by YouTube. Like, we are completely in a different world than when I started my undergrad 20 years ago, and the internet was a dial-up 14.4 baud modem. Like, this is a completely different world. So this is where I think your kind of domain that you live within is going to be important. How you get involved is what you're doing right now. You're already involved. Being vocal, becoming involved in policy, becoming involved in leadership. And it doesn't matter how big the L of leadership is. It can be the smallest L leadership all the way up to the top level, be, vice president, CEO kind of level. Whatever kind of leadership you want to entail, whatever kind of ideas you want to put across, these are valuable to build momentum, to break potentially some of the older and maybe becoming difficult to sustain in the future ways of thinking of the profession. Our profession needs to rethink itself to exist in a digital world. And sometimes we're a little bit slower than we probably should be, because we live in a hyper world now that is essentially being automated right in front of us. And we don't see it because it's so in the background and so normalized to our everyday actions. You're aware of that because you've grown up in a world with that. This is the passion I want you to take forward and channel into all activities you do in the profession. And the little bits and pieces, you start to pull people along. And when you do that, you start to become that big L leadership before you know it. And that's what I want to see you doing in the future.
All right, no pressure, guys, but you all need to be big L leaders in the future. So with that thought, I'm going to see if Sana's still able, or for the first time really, able to join us and actually get her question to Richard. Sana, we're going to try one more time. I really appreciate you and your patience for keeping trying, but talk to us and see if we can hear you. No, Sana, you're trying so hard, but it's not working. So I tell you what, Sana has actually told us what her question would have been, Richard. So stand by. I'm gonna give it to you on Sana's behalf, because sadly her connection just isn't working. So she says, how could collaborations between nursing universities with institutes of technology and engineering help to bring a change, a sort of digital progress in nursing education? Will providing specialized courses in nursing with one semester exchange programs, perhaps in AI, software, engineering, or informatics, could that help achieve the goal of digital nursing in the near future faster? That's a question.
Well, that's a fantastic question. Thank you, Senator Sommer. And so I'm sorry for the technical issues you've had. You couldn't ask that in person, but that is one of the domains I think that is really important, especially from an education perspective, to build up leadership in new and different ways moving into the future, is what I like to call creating the nurse of the future that has different elements built within it that are not potentially traditional nursing roles. So once again, as I was told that technology is not a nursing topic, I decided, no, it pretty much is. I've been using the internet for 3.5 years as an 18-year-old at this point. I know that I need to take my nursing career and merge it with technology. So having engineers, having computer scientists, having data scientists blur with nursing, evolving our role way above and beyond maybe what nursing has been conceptualized by adding new types of knowledge and background and exchanges, however modalities that might look, however kind of methods you get to that point. I think it's absolutely essential to stay, to keep a competitive advantage moving into the future. We need that kind of leverage. We need that kind of background merging with other domains of science and knowledge to really understand the future, because right now we provide lots of care, but it's still in a mindset potentially that is not where the future and where the world's going to be. We need to create a little bit more redundancy for ourselves to think about what our strategic plans are going to be in the future and how we develop a competitive advantage to stay not bleeding edge curve, but relevant in the upcoming kind of technological evolution that we're all currently within right now.
Interesting. All right. Well, Richard, thank you. We're going to now bring Alice in, because Alice, again, has been waiting very patiently. Alice, tell us a little bit about yourself, and then you've got Richard for yourself to ask him a question.
Hi, thank you so much. I just want to say first, Richard, reading the paper, I actually found it super interesting, and I think it resonates with everyone in nursing as we do move forward into sort of more technical and the digital age. Even since I started my undergraduate, there's been massive changes. So I work in Scotland in the NHS, so I do see a lot of changes day to day. And I think especially highlighted by the COVID pandemic, we have seen a lot of more input of telehealth and things like that. But my question brings it more back to sort of day-to-day ward nursing. So as we do move forward into sort of the digital health, do you feel that through the use of sort of technology and stuff that you spoke about in the paper, like clinical decision-making systems, there is that fear that nurses might become more reliant on that? And therefore there may be an issue around them not using their own clinical decision making and their own judgment, and sometimes just sort of natural instinct when treating patients, because there is that technology there, sort of that it may take over a bit where nurses may become a bit too reliant on it.
And that's a really interesting conversation. So there's kind of two elements. The first, that everyone resonates with the paper. I can tell you via Twitter that not everyone resonates with the paper, which I think is very healthy to have, because essentially the paper is a pretty aggressive approach to suggesting that we need to rethink certain things of our trajectory. So that doesn't resonate with everyone, and nor should it, because if everyone resonated, we probably would be living in a very boring world. The second part of that is that cognitive shift when we start to automate certain things, especially with the, kind of more powerful AI and machine learning and other processes that create automation for us. Is that going to sway us from our role as this knowledge provider, as this person who is a safety net for the client, who uses their clinical judgment and reasoning to do certain? And the answer is, if you look at the last 20 years of other literature that has done that in other areas, the answer is yes. That cognitive sway, when we start to embed technology that automate processes for us, changes us, and it changes the way we act with stuff. And if you look even like the last 20 years of the health informatics literature, the unintended consequence literature, where electronic barcode medication scanning creates whole new types of errors that we never knew existed. So if you take that mindset of what was essentially a very standard, seemingly simple but not simple manual process, and then you put that into artificial intelligence that now can think for itself to a certain degree and create decisions for humans. Remember how I said that the emergent technology is the stuff that keeps me up at night? Right there. That's the stuff that we need way more thought leadership. We need more people like yourself to start thinking about what are the unintended consequences when we have systems that take vast swaths of data together, smush it together, create recommendations, and then present it to you as a clinician saying, hey, this, that, and the other. This is what I'm thinking. What do you think? How does that shift your cognitive decision making? Now, we're not going to be anywhere like those movies we see where the AIs rise up. AI is still pretty dumb, all things considered. It does tiny things really well. But the internet was pretty clunky 21 years ago too, and here we are now. So this is where I want you to really start thinking about the future, the next 20 years. Is all the technology that predicts the stuff that you might buy online, all the stuff that personalizes your Google results, all the things that present in front of you in your social media platform. This is all the cognitive swaying that could potentially end up in healthcare if we don't have people like yourself to think about how we want to develop these systems moving into the future. And it's going to happen just like that, and you won't see it, and it'll be largely invisible. Like I said before, this is the thing that keeps me up most at night when I think about the future of the profession. I hope that helps, Alice.
Yeah, thank you.
All right, well, Alice, great question. Thank you. We've got time. We're almost out of time, Richard, but let's try and squeeze in a couple of questions from the audience around the world who are watching on different platforms. Sandra Andro makes a really interesting point in her question. You focused a lot on, the young nurses, like the brilliant young leaders we've got on the screen today. But Sandra's question is this: how do we prepare nurses in hospital to be involved in digital health who are from a different generation of nurses? Many of today's senior nurses are from a very different generation. How do we get them involved?
And thank you, Sandra, for the question. We sort of ran out of space, to be perfectly honest, in the BMJ paper, because we wanted to get into the more practicing nurse and individuals at various stages of their career and how they can become involved. But we're word capped there in terms of our text limit. I think really what it comes down to, and I have a couple of the presentations I've done in this domain, is to stay situationally aware of societal level technology change. Because sometimes in healthcare, we're so focused on that electronic medical record or that mobile thing that they gave me to use, that we forget about the whole system that we live within, which is the world. And all the technology, whether it be something that Amazon is pushing, whether it be some new AI that came out, whether it's that self-driving car that's sort of autonomous, that electronic battery, these are the technology things that I would suggest that if you stay aware of, you can start to see parallels and how they will start to influence the nursing profession in 10 to 15 years. Or earlier in many cases. So while it's not a formalized education strategy, becoming more situationally aware of all the technology innovation that's happening around you enables you to rip back the black box of normalization of technology. Because if you think about all the stuff that is currently potentially in your home that's connected to the internet, that's spitting out metadata about you, your house, and everything else, you'd actually kind of shake your head and go, whew, I live in this world now and I didn't actually even recognize it. This is what I suggest for individuals across the spectrum, including young leaders like here, but all different types of practicing nurses. If we stay situation alert to technology trends that are happening in society, we can be way more proactive to see what is actually coming, because what is coming is probably already in your house. You just don't know it.
Real quick then, one more. Aziza, who I believe is watching us on YouTube, she says, can there be a role for global nursing organizations like the International Nursing Council in this increasing digitalization, digitalization of the nursing profession?
Can ICN be larger? And I think, yes, like we're a globalized profession. We're the single largest healthcare providers in the world. We need to speak with a unified voice in this domain. And I think we are now at a place where we can do that, because at a drop of a hat, I can send all of you a message. We can connect in a Zoom call. We can start to shape things where 10, 15 years ago, it couldn't be possible. We now can leverage and amplify our voice. And that's what we really need to do as a profession moving in the future. And I think in groups like ICN, especially at world and global level, are very key leadership places that can take the drive and move this forward.
I just got one final, very brief question of my own. What if nurses are increasingly adapting their practice to the digital world, but what if patients and their mindset is not adapting at the same speed? You know, isn't there a danger that nurses with their new practice can leave the patients behind, and particularly older patients can feel really disconnected from this new age of nursing?
It is true, and COVID has shown that in terms of the one day everything is now virtual. If you want to speak to your family physician, it's now a telemedicine consult. This is a massive risk, and this is where it comes down to equity again. We need to think in a much broader sense about what is coming and currently what is here, and really customize to clients and patients, to be patient-centric. I know that it gets overused, but we really need to think about that. And I think one of the comments we got on Twitter is when we spoke about reframing or rethinking about the nurse-client relationship, they inverted that on us, which was a fantastic comment. I haven't gotten to respond to it yet. But we need to think about, you know, where the clients are in this and how we envelop in around that. And I have lots more things to speak about that, but I appreciate the time that we have. So it's a much larger, once again, a couple-day conference where we can speak about what the relationship of clients look like in the healthcare ecosystems of the future.
Really, Richard, believe me, it's always a very good sign when we all think, oh my God, there's so much more to say and I want to say this, that, and the other. It's a sign that we've had a very engaging and creative discussion. So, and you've led it fantastically well. So thank you very much indeed. And thank you to our brilliant panel of questioners, young nurse leaders, all of you. Thanks so much. And I'm not forgetting Sana, who's not in the picture right now, but Sana was heroic in her efforts to get connected as well. So thanks to Richard and the panel. Now, I did mention earlier that we had 2 competitions that are being launched today. We've heard about the first one, which was connected with climate change. The second is a Nursing Now challenge on the topic of nursing and digital health. And I'm hoping that Ariane in Indonesia has stayed with us to give us details of the competition and how to get involved. And after Ariane, we're briefly going to hear again from Nick Bradshaw at the WISH team. So Ariane, over to you.
Hello everyone, I'm Mariani. So it's really my pleasure here to announce the Nursing Now Challenge Global Solution Initiative focus on digital health. So what is the Nursing Now Challenge Global Solution Initiative? The Global Solution Initiative was created to provide a platform for nurses and midwives around the world to share their ideas and encourage nurses and midwife-led innovation that resolve global health issues. And for your information, this challenge aims to, first, encourage the development of practical nurse and midwife-led solution globally. Second, provide a space for nurses and midwives to share expertise and demonstrate the power of their knowledge through their innovative solutions to everyday global health challenges. And third, raise awareness of global health issues and develop bold, practical ideas to improve health. And our challenge to you is to develop an approach that uses at least one digital technology to improve person-centered care. And the launch of the challenge is today, 22nd of June, 2021. And our challenge will have webinars twice, first on 12th of July and then 2nd of August. And you need to take note this one, the deadline for the submission is on 20th of August. And for more information, you can access in the website nursingnow.org. And the prize, we are delighted that this challenge is being sponsored by WISH, the World Innovation Summit for Health. And I'd like to hand over to Nick, the Director of Partnership and Outreach, to tell you more about this exciting opportunity. Next.
Ariane, lovely to see you. Lovely to be part of this. As I've said before, not a nurse, but so thrilled to be part of this event. So back with you again. The team at WISH, not just me, obviously, the team at WISH really wants to support the Nursing Now Challenge. So we're today of $1,000 and to speak at a future WISH event. So for this one, that's based on the relationship between nurses and digital technologies, nobody is better placed to take the lead in finding global solutions to health challenges than a frontline healthcare worker. And let's face it, nurses bring a unique and powerful perspective on how to find solutions that can build a healthier world, so often coming from that frontline healthcare worker area. So go over to nursingnow.org, get actively involved in solving pressing health issues by becoming part of this next Nursing Now Challenge Global Solutions Initiative. Back to you, Stephen.
Great, Nick and Ariane, thank you so much. That's launched 2 competitions. So I hope many of you are going to try and enter one, if not both. Now, as you've probably seen from the time, we're pretty much at the end of our time, but we've got a couple more things I want to do before we formally close for today. First, I've really enjoyed hosting all the discussions. It's been fantastic. So I hope you've enjoyed it too. Before we end, we're just going to bring you on tape some final thoughts from leaders at WISH, from the Nursing Now Challenge, from the International Council of Nurses, and from the World Health Organization. So have a listen to these important voices.
Thank you for guiding us through what has been a hugely insightful and inspiring event. And thank you to our friends and partners for making today a wonderful success. And of course to everyone who has taken the time to join us today. For years, WISH has placed the greatest importance on addressing the acute nursing challenges that threaten the very functioning of our health systems. In partnership with Qatar's Ministry of Public Health, WISH was proud to launch Qatar's chapter of Nursing Now. The campaign produced some truly remarkable results, particularly in the field of research. The role of community nursing, the safety of healthcare workers, and tackling gender equality were some of the many topics our nurses researched. As a member of the committee that developed the very first WHO State of the World's Nursing Report, I recognized a real gap in the forward-facing development of nursing. The Digital Health Report makes a clear case for nurses to reframe their traditional role of hands-on care with the expertise of dealing with patients who are increasingly empowered, connected, and demand healthcare models that fit their busy lives. As one of the most trusted professions in the world, nurses can create, scale up, and disseminate climate change messages that are accessible to everyone. Providing training for healthcare practitioners to understand the effects of climate change is something we have been working on at WISH. So nurses not only convey the moral story of climate change, but also have the training that equips them to address the healthcare challenges it presents. A re-evaluation of masculinity is a reality, as we see a man's traditional role in society changing. For example, the emergence of the stay-at-home father. We must therefore destigmatize nursing to remove the stereotypical idea that every woman is a nurse and focus on the key factor, that nurses are human beings with the capacity to care. Reducing health inequalities must sit at the heart of all health policymaking. Nurses are key in delivering effective care, and their first-hand knowledge of patients as real people is vital to providing supply-sensitive and preference-sensitive care. And finally, inspired by the amazing response by nurses in Qatar to Nursing Now camp programs, we will soon be announcing the exciting launch of a research grant for nursing. So please stay tuned to our social media platforms.
Hello everybody, and thank you so much for such a wonderful event. It's my absolute pleasure to be the Programme Director for the Nursing Now Challenge, and what a fantastic day it's been, and really put the spotlight on just how wonderful our early career nurses and midwives are in engaging in debate, discussion, and making sure that their voices are heard. I've very much enjoyed reading the three publications, the health equity, the digital health, and the climate change. And as a nurse myself, not only am I compelled to really take action in these spaces, but there's a call to action also, I think, for nurses and midwives all over the world to demonstrate their ability to respond to the recommendations within these reports, to be role models and really use them to further influence the work that they do that's so vitally important across communities all over the world. But what's clear to me in reading these reports is that it's critical that in order to improve access to quality healthcare, we need to continue to ensure that nurses are invested in, that they are around the decision-making tables, and that they continue to be supported as leaders and advocates in all of the work that they do. As many of you may know, we've got a really exciting ambition here at the Nursing Now Challenge, and that is to create 100,000 early career nurses and midwives all across the world that are engaged and supported in leadership development and activities. And I strongly believe that through this, they will be able to deliver better healthcare for more people everywhere. Thank you very much.
Hello everyone, Howard Catton here, nurse and CEO at the International Council of Nurses. My huge congratulations to you all for a fantastic debate and discussion, to the Nursing Now Challenge, the WISH Foundation, the authors of the fabulous papers as well. Colleagues, I think we are at a moment where the choices and decisions that the world face and need to make about the health of people and the health of the planet and the future of nursing, the future of the nursing profession, have never been more intimately connected. This is a massive moment of opportunity, of choices, and I hope change. And I say that for these brief reasons. The pandemic has exposed, like we've known for many, many years, the lack of preparedness of our health systems, weaknesses in our health systems, the failure to invest in nursing, not to take public health, mental health seriously, to look at prevention, to integrate our health systems, all issues that nursing has been raising concerns about for many years, often told that we were scaremongering. We weren't, we were right about the diagnosis. The response to the pandemic, nursing has been front and center, not just its care and compassion, though, but people have seen the complexity, the courage, the leadership, nurses literally walking in the shoes of patients and their families and their carers. The image of nursing, I believe, has changed. People see the science as well as the art. But then looking to the future, we look at what future healthcare challenges are: aging, non-communicable diseases, disaster response, palliative care, for example. Let's call this what it is. It is nursing work. Don't let others take another name for it. But we also see nurses who have had enough of dealing with ill health, who say, we're going to go upstream. We're going to tackle those causes of prevention. We know this is about people not having good jobs, having decent housing, being in poverty. And people are seeing that global has never been more local. So our fates, I believe, are intimately intertwined. What is needed, though, what the world is looking for, is new leadership. It's looking for leadership that puts people first, that can work across communities, across nations, that does the right things, that has a code of ethics and practice that guides what it does as well. I think the world is looking for nursing leadership. And I don't think that that's a pipe dream, because I think that we have the power, we have the authority, but we don't need to be asked anymore. We don't need to be granted permission. We step up and we take it. And now is that time. But we will do it in a very nursing way, in a very perhaps understated way. Perhaps what I might see the time now for a nursing velvet revolution. Thank you.
Elizabeth Eero from the WHO. Today we have listened to nurses who have led excellent pieces, authored pieces on the nurse's central role in digital future, in climate action, in health equity, and also heard from young nurse leaders and heard their perspectives as well. This is excellent. Thank you for sharing your stories and highlighting our needs to do more. There is more to do, much more. Nurses are in a pivotal position to lead work on public health initiatives, vaccination programs, and education. In my previous role working as head of the Ministry of Health in a small island development stage, it has given me first-hand experience of topics discussed today, impacting vulnerable populations, especially those on remote islands. As we move forward, we must maximize our use of the advancing technologies available for education and training, and for continuing professional developments for networking, and enable a support system for each other, sharing our knowledge, learning from each other, and supporting our networks around the world is critical if we are to build sustainable systems and be ready to respond to emerging disasters swiftly. I am hopeful that this is a positive step towards uniting our profession in our commitment to tackling the serious issues ahead of us, and we stand together at the forefront of change. I am confident we are well placed to tackle these challenges head on. The WHO Global Strategic Directions for Nursing and Midwifery provides policy options to make the necessary shift to strengthen nursing and midwifery, and calls on governments and partners to make the investment in nursing education, in jobs, decent work conditions, in service delivery, and in leadership. Components, all four components that we heard mentioned in the different panels today. I urge everyone to continue to work together. Our partnership and collaboration with multidisciplinary professionals, organizations will be critical as we move forward. I thank you.
Elizabeth, thank you very much. It is time for some big thank yous from me too, just before we formally close this wonderful event. Thanks to everybody who took part in all of our three panel sessions, all of the participants, all of the speakers, all of you who listened and put forward your questions too. That was very much appreciated by me and everybody on the team who organized today's events. Thanks particularly, of course, to our keynote speakers, to Elizabeth Eero, whom we've just heard from, Sir Michael Marmot, from Sultana Afdal, Lisa Bayliss-Pratt, and Howard Catton, who all gave us their contributions toward the close of today. Thanks so much for all of your inspiring thoughts, your optimism about the future of nursing as well. That is pretty much it from all of us. This session on nursing at the forefront of change has been extremely interesting and rewarding for me. I hope it's been the same for you too. Before we go, I'm going to leave you with something that I think is quite important. And funnily enough, it's something which resonates with me a great deal because it's actually a contribution by the British author and poet Michael Rosen, whom I had on my BBC TV show Hard Talk just the other day, talking about his extraordinary experience with COVID-19. Michael very nearly died, having contracted a horrible form of COVID early in the pandemic. He spent more than 40 days in an induced coma. I think the doctors really thought that he would never recover, but miraculously he has recovered. He talked to me just a few days ago, but also what he did before COVID, because he's had quite a lot of experience with the National Health Service in the UK, he wrote the most extraordinary poem, a tribute to nurses, nursing, and the NHS in the UK. And we wanted to end by bringing just a little bit of this poem to you. It's been read for us by the actress Emilia Clarke, who herself is an ambassador for the Nursing Now Challenge. So I'm going to say goodbye to all of you. Thank you very much for being with us today. And let's end with the wonderful words of Michael Rosen.
These are the hands that touch us first. Feel your head, find the pulse, and make your bed. These are the hands that tap your back, test the skin, hold your arm, wheel the bin, change the bulb, fix the drip, pour the jug, replace your hip. These are the hands that fill the bath, mop the floor, flick the switch, soothe the sore, burn the swabs, give us a jab, throw out sharps, design the lab. And these are the hands that stop the leaks, empty the pan, wipe the pipes, carry the can, clamp the veins, make the cast, log the dose, and touch us last.